morning, everyone. I'd like to call the March 21st meeting of the Human Services Committee to order. And with that, I will turn it to my co-chairs and rankings to make announcements.
Good morning, everyone. As you may know, today is by some accounts the first day of spring. It is also Representative Gilchrist's birthday today. So would love to extend our usual greeting to Representative Gilchrist. Could not think of a better thing to do than to celebrate with all of you. And unfortunately, the committee was not able to get cupcakes for everyone present, but we do have them for members of the committee and for staff. So if you want to stop by the Human Services Committee at any point, we checked with our lawyers and we could not exchange that in exchange for a yes vote. So yeah, you can vote however you want and you're still eligible for a cupcake. And with that, just looking forward, we have a lot of work to do today and looking forward to a spirited discussion. And I'll turn it back to you, Madam Chair.
Thank you so much, Senator Lesser, and everyone for your applause. Representative Case.
Thank you, Madam Chair, and happy birthday. I wish I had a yellow sticky note to give you, but it's today we have a lot on our plate. I just want to say, we worked very diligently. We talked, we went through a lot of bills. It's very difficult. I think we spoke yesterday at 3:30 where we got a great agenda put forward nice and early, but at 5:30 we got a whole stack of S language that changed a lot of these bills drastically. So that's why we cannot have a consent calendar today, but it will be a long day. So thank you. Sorry, and even on your birthday.
It will be memorable. Thank you, Representative Case. Senator Seminara.
Good morning, everybody, and happy birthday, Madam Chair, with your new haircut looking very stylish as well. I just want to begin by saying I'm a bit disappointed that there was so much S language and getting it rather late in the game. And I think it has made some of us have to change our minds in terms of some of these bills, but we will carry on and look forward to the robust discussion.
Thank you both very much. I'll just say before we get started, recognizing that it is frustrating to get it so late. But as we always say, in this committee and all the committees we sit on, there's a lot of work going on. And so to be able to get together with my good co-chair can be difficult sometimes. And so we did, well, because you're busy, because we're all busy. And so we did the best we could to get the information to you as fast as we could. But with that, let's get going. And so we'll move to section 3 on the agenda. Senate Bill number 10, an act promoting access to affordable prescription drugs, healthcare coverage, transparency in healthcare costs, home and community-based support for vulnerable persons, and rights regarding gender identity and expression. Do I have a motion?
So moved.
Is there a second?
Rep. Huso, seconded.
Great. Moved by Senator Lesser and seconded by Representative Hughes. I will turn it over to Senator Lesser.
Yes, thank you, Madam Chair. And Madam Chair, this is a Senate Democratic caucus proposal, and I will go through it in as much detail as folks would like. We do not have any S language on this bill today, and I think the attempt there is to just underscore that this is a bit of a moving target, but I will give an update on where things stand for right now. Section 1 of the bill strengthens an existing transparency requirement regarding the cost of outpatient prescription drugs that is provided to the Office of Health Strategy to try to get more data on prescription drugs as a cost driver. Sections 2 to 4 attempt to piggyback on the recently passed Inflation Reduction Act, which for the first time allows Medicare to negotiate prescription drug prices and establishes a maximum fair price that can be charged any payer in Connecticut, including the state's Medicaid program, but also private payers to try to bring down the cost of prescription drugs. Sections 5 and 6 require 340B covered entities, so that's safety net hospitals, to pass on prescription drug discounts that they get to their patients. Section 7 allows us to piggyback on a prescription drug advisory board established by another state. Section 8 creates a prescription drug discount program administered by the state comptroller. Section 9 focuses on tiering and steering clauses in contracts. This is about monopoly power in healthcare, and trying to make sure that emerging healthcare monopolies don't raise costs for the entire healthcare system in the state. Section 10 requires DSS to include at least 2 licensed clinical social worker visits in the fee schedule for people enrolled in certain plans administered by DSS. I will say, as an aside, it is our intention to remove the language in section 10 at a later date at this point. Sections 11 and 12 pertain to community health workers. And I want to say that although we are not inserting JFS language on that section, but we are on Senate Bill 991, which also pertains to community health workers. And the language that is in Senate Bill 991 will make it into SB 10, hopefully at a later date. And I want to thank the entire community of folks who are interested in that issue for working together in a collaborative manner to address concerns about the community health worker language of this bill. Section 12 concerns, section 12 is about that. I already talked about that. Section 13 and 14 expand the covered Connecticut program. Section 15 gets Access Health some more data. It's a governor's proposal. Section requires an MOU with the Department of Revenue Services. Section 16 through 20 section 16 through 22 expands support for transgender individuals in the state, both with respect to DSS and also to some other state agencies, and update the definition of gender affirming healthcare services. So that is a quick summary, but happy to discuss any particular part in as much detail as members would like.
Thank you, Senator Lesser. Any comments or questions? Okay. Representative Master Francesco. Thank you. If you can bear with me for a moment, you went through that fairly quickly without a lot of detail. And I just kind of want to go through it again, if that's okay. On section 1 of the bill, it's line 7. I guess currently right now, the Commissioner of Social Services does not make public any of the 10 the high cost prescriptions. Is that correct? And this part of the bill will make that information public. Am I reading that correctly through you? Senator Lesser.
Through you, yeah, it makes it explicitly public.
Okay. Representative Master Francesco. Thank you. And when they say make public, will that be on the website? How will that be made public through you? Senator Lesser.
I believe so. Through you.
Representative Master Francesco. Thank you. Also on lines, if you can just elaborate a little bit more, because I know you went through this really quick. Lines 22 through 45. There's a lot of new language there. Would you mind giving a little bit more detailed explanation on that? Through you. Senator Lesser.
Through you, some of the language is about the public comment process. It's about the specific administrative process by which the director of the Office of Health Strategies shall obtain the information. It also clarifies that that it covers the wholesale acquisition cost of the drug, less all rebates pays to the state for such drugs. So one of the questions is making sure that rebates don't obscure the underlying cost questions. Through you.
Representative Master Francesco. Thank you. And on lines 26 and 27, it says the executive director shall make the preliminary list available for public comment for not less than 30 days. What does that mean specifically? Does that mean after the 30 days, it comes off? Senator Lesser.
Through you, it's about the length of the public comment period.
Representative Master Francesco. Sorry, I'm sorry, Senator. Can you repeat that? Senator Lesser.
Yes, Madam Chair. It's it specifies the length of the public comment period, which has to be at least 30 days, but it could be longer than 30 days.
Representative Master Francesco.
Thank you. Okay, so moving on to line 68, there's a new section there that talks about, I believe, contracts. Can you kind of go over a little bit on what that means in that section? Is that all this whole section new from line 68 through? $151? Is that all new statutory language? Through you.
Senator Lesser.
Through you, Madam Chair, yes.
Thank you. Would you mind going over those sections for me to kind of explain exactly what they mean?
Senator Lesser.
Yes, thank you, Madam Chair, and through you to the honorable representative. Sections 2 through 4, which I believe you're asking about, generally prohibits purchasers from purchasing prescription drugs for prices above the maximum fair price. It prohibits drug manufacturers and distributors from withdrawing drugs from sale or distribution in the state to avoid revenue loss, and it sets penalties and reporting requirements.
Thank you. And when you mentioned maximum fair price, where is that determined? How is that maximum fair price determined and who determines that?
Thank you, Madam.
Senator Lesser.
Thank you. I want to be deferential here. So maximum fair price, through you, Madam Chair, is the maximum rate for a prescription drug published by the United States Department of Health and Human Services under the Federal Inflation Reduction Act.
Representative Master Francesco.
Thank you. Okay, moving on to. And I'm just curious, you haven't heard the ERISA plans. How would this section affect the ERISA plans?
Senator Lesser.
So we are generally, through you, Madam Chair, we are generally preempted from regulating ERISA plans because ERISA is a federal law, but allows ERISA plans to opt into the maximum fair price, so to pass on the savings to their members.
Representative Master Francesco.
Thank you. Bear with me for a moment here. And when they talk about lines 141, you're talking about reference drugs, right? It means any prescription drug subject to the maximum fair price. And where would you find the list of those reference drugs?
Senator Lesser.
Thank you, Madam Chair. Through you, as I mentioned before, it's the U.S. Department of Health and Human Services.
Representative Master Francesco.
Thank you. Moving down to lines 152, section 3 is all new, I'm assuming, from lines 152 down to 178. Is that correct?
Senator Lesser.
Some of that language is new, some of it's existing, through you.
Okay.
Representative Master Francesco.
Thank you. So on lines 150, 53, it starts as no purchaser shall purchase a reference drug or seek reimbursement for a reference drug to be dispensed. Can you elaborate on a little bit more on that? What does that mean?
Senator Lesser.
Thank you, Madam Chair. I actually apologize. I was looking at the wrong bill when I said some of that. This is all new language, and I want to apologize. I was have two tabs open on my browser. So 152 to 160, that whole section 3 and beyond is new language. And apologies for the mistake.
No, that's okay. I understand that. I'm just curious exactly if you can explain a little bit more in detail what that means from 152 to 160. It says no purchaser shall purchase a reference drug or seek reimbursement for a reference drug to be dispensed. What does that mean?
Senator Lesser.
So the question is, how can we pass on the savings of the Inflation Reduction Act in a way that is compatible with the U.S. Constitution, the state constitution, state law, federal law, and the question is, how do we make sure that that is compliant? And this language this formulation was suggested to us by NASHP, the National Association of State Health Plan folks. I'm not sure if that's the correct line, but it's the idea is rather than regulate prices, we are regulating purchasers and saying that they should really look to the negotiated federal prices as a lodestar. Through you.
Representative Master Francesco.
Thank you. So if I understand this correctly, is that nobody can purchase a reference drug or get reimbursements for the drug to be dispensed, delivered or administered to an insured in this state. So in other words, a manufacturer cannot dispense or deliver a certain drug. And correct me if I'm wrong, because this is all new. They can't send it by mail, hand delivery, go through a distributor if that particular drug exceeds the maximum fair price. Is that the right analogy? Am I looking at that correctly? Through you.
Senator Lesser.
No, Madam Chair, through you. This is not about the price that a purchaser can be paid. It's a question. It's a question of the manufacturer can be paid. It does not restrict manufacturers. This reflects what purchasers can pay.
Okay, thank you. And through you. So I was confused, I guess, because it talks in there about mail, by other means of getting that drug over to you by hand delivery or through a distributor. And I think that is the part that was confusing. Through you. What does that have to do with what you were just talking about? Through you.
Senator Lesser.
Well, I think you can purchase a drug either directly from the drug manufacturer or through a distributor. Through you, it reflects the fact that we are focusing on what a purchaser pays, regardless of who they pay.
Representative Master Francesco.
Okay, thank you.
Madam Chair.
Senator Lesser.
It's been brought to my attention that NASHP stands for the National Academy for State Health Policy, and I want to apologize to them for mangling their acronym.
Thank you, Senator. Representative Master Francesco.
Thank you. And through you, you had mentioned before that this won't affect the ERISA plans, but they may elect to participate if I'm reading this correctly. Is that correct? Through you, Madam Chair.
Senator Lesser.
Yes, as I stated previously, that's correct. That's the case.
Thank you.
Representative Master Francesco.
Okay, on to section 4. So if I'm understanding this correctly, if you can maybe just elaborate on this a little bit. It says no manufacturer, distributor, or of a reference drug shall withdraw the drug from sale or distribution to avoid any loss of revenue. So if the drug manufacturer or the distributor is losing money on a specific prescription or drug, what this is basically saying is that you still must offer it. Is that correct? Through you?
Senator Lesser.
I think the intent is to make sure that a drug is not withdrawn from the market to avoid the provisions of Senate Bill 10. For you.
Representative Master Francesco.
Thank you. So that is correct. So if a manufacturer, distributor, or pharmacy, whatever, is losing money on a specific drug, this basically mandates that they still would need to supply it, if that's what I'm understanding correctly. Okay. So if lines 179 through 184 say that because of a loss of revenue, they cannot withdraw from offering that particular drug, but then it goes on the lines 185 to 188. It talks about that they should give 180 days written notice to the insurance commissioner prior to withdrawing a reference drug. Does that conflict with each other? Because in one section, you're saying that they cannot do that, but in section 185 through 188, you're saying that they need to give notice. Through you.
Senator Lesser.
Through you, Madam Chair. Obviously, a drug manufacturer can make business decisions or a distributor. The specific thing that's prohibited is avoiding the provisions of Section 3 of this bill. So if the decision is solely to evade the maximum fair price requirement in Section 3, that would be a prohibited act. What we're just saying is that if they are generally withdrawing a drug from the market, they should provide notice to the insurance commissioner and the attorney general, so we can figure that out.
Thank you.
Representative Master Francesco.
Thank you, Madam Chair. So what would be the penalty should they withdraw from offering that certain drug? through you.
Senator Lesser,
If they violate the law, the penalty will be a civil penalty of $500,000 or such purchaser's amount of annual savings generated pursuant to subsection A of section 3, whichever is greater, and it's determined by the insurance commissioner.
Representative Master Francesco,
Thank you, Madam Chair. And you mentioned that the fine would be $500,000 and that is for one prescription one drug that they withdrew? And can you explain, show me in what reference, on what line in this bill it references the $500,000 through you?
Senator Lesser,
Yes, thank you. That's on line 191, and it's either $500,000 or the annual savings, whichever is greater.
Representative Master Francesco,
Thank you, Madam Chair. And that is for one particular drug. So if there was multiple drugs that they decided not to, because it was a loss of revenue for them, it would be $500,000 per drug.
Senator Lesser,
Through you, yes, although I will just emphasize that there are a limited number of drugs covered, so it's possible that one manufacturer would have multiple drugs, but perhaps not super likely.
Thank you. And through you, Madam Chair. And also in here says, so if they're going to be fined $500,000, that would be prosecuted through the Attorney General's office. Is that correct when they refer to on lines 198, 199? The Attorney General will have the sole authority to enforce that violation through you?
Senator Lesser,
Yes, that's the language on 198 and 199.
Representative Master Francesco,
Thank you. Give me 1 second here. So it looks like sections on lines 200 to 222 that's all new language in this bill, new statutory language. Can you kind of just go into a little bit more detail exactly what that means in that section 5?
Senator Lesser,
Yes, thank you, Madam Chair. So 340B is a federal discount drug program that's available for safety net hospitals, for federally qualified health centers, for Ryan White clinics, and perhaps a couple of other types of services that serve the poor. Specifically, what this is designed to do is to require that 340B covered entities, those are entities that receive discount drugs through that program, pass on the savings to their clients. Through you.
Representative Master Francesco,
Thank you. So on lines 223, you talked about covered, you mentioned the 340B covered entity. Can you elaborate exactly, just so the public, so they understand what a 340B entity is?
Senator Lesser,
Yes, Madam Chair. Madam Chair, I think I've answered this question now twice previously. I will answer it a third time. So a 340B covered entity is a safety net hospital, a Ryan White clinic, a federally qualified health center, or a family planning clinic. Through you.
Representative Master Francesco,
Thank you. Thank you, Senator. I appreciate it. I'm trying to read this. We got this language very late. You went through it really quick, so I'm trying to read through it.
Madam
at the same
Chair,
time, so I
Madam Chair,
appreciate it.
Yes, Senator Lesser.
this is the language that's been in the bill now for several weeks. There's no JFS.
I understand that. A
And
lot
we
of,
did have a public hearing on this bill.
I understand that, Madam Chair, but many times we get language late. So I get it. And I understand in this particular one, we did not. We always anticipate to get language late. So I just want to make sure that during the public hearing, we don't go through all the bill details. And I think it's important that the public understands what's in the language as opposed to just calling a bill. And I know I'm probably asking detailed questions, but to just call a bill, it's how many pages, 50 or so pages. The public's not going to read it because they don't really understand the language as we do. And that is why I'm really trying to go through this. And I may be asking you questions that are redundant, but it's really for the purpose of the public can understand exactly what we're voting on. So I hope you would just give me a little latitude on that, but I do appreciate it, Senator. So it says here on lines 223 to 227 that the covered entity shall attempt to collect as medical debt payment. Are they saying that you cannot attempt to collect any debt payment on that? Is that correct? And that's new language. So I guess what I'm trying to say is previously, was the entity able to collect any debt on that? And now we're saying that they cannot. Was that in statute before, or this is all new?
Senator Lesser,
Thank you, Madam Chair. I'm a little confused as to what the question is. This is section 6 is new language.
Representative Master Francesco,
Thank you, Madam Chair. So it says here, no 340B covered entity shall attempt to collect as medical debt any payments for a prescription drug obtained. So I'm assuming if this is new language, there was no provision prior that would prevent or that would allow. So this is all new. So this is new, saying that they are no longer can collect as medical debt any payment. That is correct. This is new language. So I understand that. On section 7, they're going to establish a prescription drug payment evaluation committee. And through you, Mr. Senator, through you, Madam Chair, can you please, just so the public could know, what does that committee entail? Who is on that committee? And who are they appointed by, through you?
Senator Lesser,
Thank you, Madam Chair. Their member of the committees shall be as follows: 3 appointed by the Speaker of the House, 3 appointed by the President pro tem of the Senate, 2 appointed by the Majority Leader of the House, 2 appointed by the Minority Leader of the House, 2 appointed by the Majority Leader of the Senate, 2 appointed by the Minority, 2 appointed by the Majority Leader of the Senate, 2 appointed by the Minority Leader of the Senate, 2 appointed by the Governor, the Secretary of the Office of Policy and Management, the Commissioner of Social Services, the Commissioner of Public Health, the Insurance Commissioner, the Commissioner of Consumer Protection, the Executive Director of the Office of Health Strategy, the Healthcare Advocate, and that is it. Through you.
Representative Master Francesco,
Thank you for that explanation. I appreciate that, so people understand. See if there's a change on section 8. So on section 8, it's allowing the controller to establish a prescription drug discount card program available to all residents in the state. And I know many people get these discount drugs through maybe third parties or so forth. Can you explain to me, it says here, the controller may coordinate participation in a multi-state prescription drug consortium for the purpose of pooling prescription drug purchasing power. How would that process work, through you?
Senator Lesser,
Thank you, Madam Chair. There's a existing interstate consortium called Array RX. And this would allow the comptroller to participate in that pooling consortium and then pass on savings to Connecticut residents. Through you.
Representative Master Francesco,
Thank you, Madam Chair. And through you, I'm assuming that this discount card would be very similar to the cards that we see out there now. I know some towns offer them. Would that be a similar program, but only now this would be administered through the state of Connecticut, through you?
Senator Lesser,
Through you, Madam Chair. Yeah.
Representative Master Francesco,
Thank you. On lines 340, there's an all or nothing clause. Would you kind of explain what that means?
Senator Lesser,
Yes, thank you, Madam President. Getting ahead of ourselves. Thank you, Madam Chair. Madam Chair, the language specifically is similar to legislation that passed through the state Senate last year that is concerning specific language in healthcare contracts. So there are terms that require participation by a purchaser into cover all of healthcare facilities owned by a single hospital chain, and this would exclude that.
Representative Master Francesco,
Thank you. On lines 348, you talk about, and this is new language, an anti-steering clause. Would you kind of explain that for me, through you?
Senator Lesser,
An anti-steering clause, Madam Chair, through you, means a provision of a healthcare contract that restricts the ability of the health insurance carrier or health plan administrator from encouraging an enrollee to obtain a health service from a competitor of the hospital or health system, including offering incentives to encourage enrollees to utilize specific healthcare providers. I think the intent is to allow us to is to prohibit is to ensure that we can provide information about lower cost providers through you.
Representative Master Francesco,
Thank you. Okay, let me go on here. And on lines 373 and 371, they talk about a tiered network, and on 373 valued-based care. Can you kind of explain? I know what the language says here, but I'm trying to get so people can actually understand this. And I know language is really kind of hard to read. Can you kind of explain it in simple terms on what that means?
Senator Lesser.
Thank you, Madam Chair. Value-based care means healthcare coverage model in which providers, including hospitals and physicians, are paid based on patient healthcare outcomes.
Representative Master Francesco.
Thank you. Moving on to lines 524. I guess it's basically talking about the health insurance carrier or healthcare provider that they cannot enter into a contract that would directly or indirectly include any of the following provisions. And I'm assuming this is what you talked about before: an all or nothing clause, anti-steering clause, anti-tier clause, or any other clause that results or intends to result in anti-competitive effects. Can you explain to me what the purpose of that is?
Senator Lesser.
Yes, thank you, Madam Chair. The purpose is to address consolidation in healthcare and the ability of hospital chains or healthcare monopolies to artificially raise prices in the marketplace. And the intent is to prohibit anti-competitive clauses in contracts. Through you.
Representative Master Francesco.
Thank you. So this is basically the state getting involved in a private contract between two entities. Is that correct?
Senator Lesser.
Through you, this is about ensuring a fair marketplace and prohibiting anti-competitive practices by monopolies. Through you.
Representative Master Francesco.
Thank you. So I guess my thought is that it's the government kind of getting involved in private contracts that probably should be left to the industry to manage themselves. Let's see here. Moving on. Got a lot of pages here. Okay, so on lines 561, it talks about the commissioner has to include a fee schedule for 2 licensed clinical social workers to visit the home care program for the elderly. How right now there is no, if I'm assuming because you have 2 licensed clinical social workers here, are there any social workers correctly right now in that program that are doing those home care for the program for the elderly? And we are increasing it to 2, or there is none currently?
Senator Lesser.
Thank you, Madam Chair. Madam Chair, this language would require that the home care program pay for at least 2 licensed social worker visits to each individual. Currently, there is no such requirement. And I just want to remind the gentlelady through you that we did express earlier that our intent to remove this language in a subsequent draft of the bill. Through you.
Representative Master Francesco.
Thank you for that reminder, Senator. So this section will be removed, not edited. It's going to be completely taken out of here, I'm assuming. And is that correct? Not
Senator Lesser.
replaced.
Through you, yes.
Thank you. Thank you very much for that. Okay, moving on to lines 587, section 11. It talks about a certified community health worker. And I guess here it's the social service commissioner, social service. They're going to implement a program to provide Medicaid reimbursement to the certified healthcare workers through the Husky program. Do we know, and I know this bill probably has to go to appropriations, but do we know an idea of cost and how many people this would affect? Through you.
Senator Lesser.
Through you, Madam Chair, no, we are asking the Commissioner of Social Services to design a program. I will say that the Commissioner believes that she has funding in her budget to do this, so we don't anticipate this will result in an additional cost to the state. Through you.
Representative Master Francesco.
Thank you. And I'm assuming all of this would be through the Husky program through Medicaid. And would we be getting a federal match on this? Through you.
Senator Lesser.
Yes, we would be getting a federal match. Through you.
Representative Master Francesca.
Thank you. And is that federal match like the other ones at 50%, or would we have to apply for a waiver through you?
Senator Lesser.
Through you, Madam Chair, we would have to apply for a waiver. We believe we would, in the exact size of the match would depend on the services covered through you.
Representative Master Francesca.
Thank you. And I guess when we apply for a Medicaid waiver, should we not get approved for that waiver, then the state would have to pay the other 50%. Is that correct? I'm assuming that the program wouldn't go away. We would, somehow the state would have to come up with the money through you.
Senator Lesser.
Thank you. We feel very confident that we're going to get approved. We've most states, most might be an overstatement. Many states are getting reimbursed currently for community health work, and we believe very strongly that DSS will be approved.
Representative Master Francesca.
Thank you. On line 665, you talk about forums and meetings with Access Health Connecticut. Can you elaborate on that section a little bit more so people can understand what it's actually doing through you?
Senator Lesser.
Yes, thank you, Madam Chair. I just want to make clear that the substitute language that we're seeing in Senate Bill 991 will replace the sections of SB 10 that cover community health workers, and the substitute language does replace the language that you're seeing. I'm happy to discuss what that discusses, but it's it's about stakeholder input that the Office of Health Strategy was supposed to undertake in SB 10, but I've expressed agreement by all the parties to remove that language going forward.
Representative Master Francesca.
Thank you. Thank you for that answer, Senator. And then moving on to section 13. Again, on line 684. Can you talk a little bit about a waiver that's for that provide coverage for the Covered Connecticut program? Can you elaborate on that section so people can understand exactly what that is through you?
Senator Lesser.
Yes, Madam Chair, this is to respond to the unwinding of the public health emergency, and it seeks to expand the Covered Connecticut program to persons whose incomes do not exceed 200% of the poverty level in this section through you.
Representative Master Francesca.
So if I understand this correctly, during the COVID-19 with ARPA funding, the poverty level, the funding used for this, the poverty level was increased. And now that funding is kind of going away. Am I to imply that we are trying to keep this at the 200% of the federal poverty level so the program can continue through you?
Senator Lesser.
Oh, what we're seeing is that due to the unwinding, folks are being redetermined for their eligibility for the Medicaid program. And as a result, Covered Connecticut seems like a good place for folks who are no longer eligible to land through you.
Representative Master Francesca.
Thank you. And in line 693, section 14, it talks about the Commissioner of Social Services working to create a second tier for the Covered Connecticut program. Can you elaborate a little bit more on the second tier?
Senator Lesser.
Yes, thank you. This is to design, and this is in response to changing federal support for the state's health insurance exchange and also for the state's Medicaid program to within available appropriations address this higher income population and affordability of healthcare through a lower tiered Covered Connecticut program.
Representative Master Francesca.
Thank you. So right now, the qualified program is for 200% of the federal poverty level. And this tier will make it up to 300%, if I'm understanding that correctly. Do you know the dollar figure for the 200% of the poverty level and the 300%? Through you.
Senator Lesser.
The dollar figure in terms of the fiscal impact on the state, or what or how much 200% of poverty is?
Yes, I apologize for not clarifying that. Yeah, what is exactly what amount of income would qualify you for tier 1 and what income would qualify you for tier 2 through you?
Senator Lesser.
Good question. So I'm looking at federal poverty levels. It appears that a family of two would be $39,440 at 200% of poverty, and $59,160 at 300% of poverty. And that goes up depending on family size or down depending on family size.
Representative Master Francesco.
Thank you. And through you, Madam Chair, the 59,000 is a family of two as well, through you.
Senator Lesser.
300% of poverty is $59,160 for a family of two. A family of four would be 90,000.
Representative Master Francesco.
Thank you. And I'm assuming from line 704 down to, this seems to be a pretty long section, to 746, that is all new language as well.
Senator
you.
Lesser.
I'm sorry, which section?
It was, I'm on line 704, goes from 704 to 746. That is all brand new statutory language.
Yes, that's all pertains to that reduced benefit level that we just discussed through you.
Thank you. There's a lot of language here that I know it talks to. If you wouldn't mind, please, can you go into a little bit more detail for the public so they can kind of understand exactly what that does? Through you.
Senator Lesser.
Yes, thank you, Madam Chair. It's actually very simple. It just requires that this committee and appropriations approve the plan developed by the commissioner.
Representative Master Francesco.
Thank you, Madam Chair. That's a short sentence for 50 lines, but I appreciate it. You know, there's a lot of lines in here. Okay, moving on to section 15. It doesn't seem to be a new section, but there seems to be some modifications in that section. Is that correct? I'm all the way down to trying to see what's new in that section here. On lines. Section 15 on 747, it seems to be existing statute language. And I'm trying to see here where I saw that, what's changing in here. And it goes down to, I guess, lines 931 is where the change begins. Is that correct? Notwithstanding the provision of section 12-15 of the exchange shall make a written request. Is that the new language that's inserted in that section through you?
Senator Lesser.
Through you, Madam Chair, yes.
I'll take it. Representative Master.
One day.
Thank you, Madam President. It's your birthday today. Why not? Okay. So if you wouldn't mind lines 931, that goes down to 958. Can you elaborate a little bit more as opposed to what that means for the public through you?
Senator Lesser.
Yes, it requires an MOU between the Commissioner of Revenue Services and Access Health for purposes of enrolling folks in coverage through you.
Representative Master Francesco.
Thank you. So, you said something, you just mentioned there that for the Department of Revenue Service, a memorandum of understanding to enroll who through you?
Senator Lesser.
Eligible individuals, uninsured state residents.
Representative Master Francesco.
Thank you. So am I to assume that the Department of Revenue Service is the ones that are going to be reaching out, looking for people who are eligible for this program to enroll in it through you?
Senator Lesser.
No, the Access Health will be through you.
Representative Master Francesco.
Thank you. And then for Access Health to reach out to, I guess I'm trying to figure out, why is the Department of Revenue Service getting an MOU for Access Health to go out into the community to try to recruit eligible residents for this program through you?
Senator Lesser.
This provision would create, through you, Madam Chair, a provision on a tax form for residents to authorize Access Health to get information to them about their eligibility for free or low-cost health insurance.
Representative Master Francesco.
Thank you. So on Access Health, when they, I'm still not understanding. If you can just be a little bit more detailed. I know you're getting a little frustrated. I can see it in your face, but this is a lot of information and the public really needs to understand it. We don't get to ask these questions during a public hearing because most times during a public hearing, we only get 2 questions. So I'm being a little bit more detailed here so people can clearly understand it. What does the Department of Revenue Service have to do with with this? I don't understand this. Explain it to me, please, through you.
Senator Lesser.
And thank you, Madam Chair. And I would just be clear, I am not frustrated at answering any questions about this bill or any bill. Sometimes when, I repeat myself, that would be frustrating, but certainly the representative is welcome to ask any questions about this legislation, and that is not a problem. Specifically, I will just restate what I said before. What we're doing here is creating a checkbox on a tax form for an individual to opt in to getting information about free or low cost health insurance through Access Health on their tax form. Through you.
Representative Master Francesco.
Thank you. So that clarifies it. So now on your tax form, for the state of Connecticut, I'm assuming there'll be a box there to check so that you can enroll in Access Health if you qualify. Is that correct?
Senator Lesser.
Yes.
So the state of Connecticut is going out trying to encourage or find people that are, or make them aware whether they are eligible for the program through the tax forms. That I understand that now correctly. Thank you. Let's see, going down to section 16th. Talks about changing one's birth certificate, their legal name on the birth certificate. I assume that if somebody wanted to go down and change their birth certificate, they can certainly do that. So what are we saying here? It says here, only the commissioner may amend birth certificates to reflect changes concerning parentage or the legal name of a parent, or birth or marriage certificates to reflect changes concerning gender. Weren't they able to do that before? Well, I assume in here the commissioner is the one who amends the birth certificates. Why is it now that if there's a change in here, or the legal name of the parent? What does that mean? Through you.
Senator Lesser.
I think it reflects the fact that a parent may change their name, and so it simplifies that. Through you.
Representative Master Francesco.
Thank you. It's a little confusing. It doesn't really make sense to me. The commissioner can change the birth certificates. I assume on the birth certificate, that is the legal name of the parent anyway. But now you're saying that they could change the legal name of the parent, but that's already on the birth certificate. It's very confusing. Okay, moving on. Again, it's talking all these sections, it's amending on lines 995. It's talking about amendments concerning parentage. What does that mean, concerning, on lines 995 through you?
Senator Lesser.
Through you, I think that is a technical and conforming change to existing language.
Thank you. I understand that. But what does concerning mean? You either are a parent or you're not. I don't understand what the word concerning. What is the meaning of this word in relation to parent? Through you.
Senator Lesser.
So, Madam Chair, through you, that is existing language that allows a birth certificate to be changed for if new information comes to light about a person's parentage. The current law is due to parentage, and I believe LCO is recommending that we change it to concerning parentage. I don't think there's a substantive change meaning to that. I think it's just a grammatical change. Through you.
Representative Master Francesco.
Thank you. Well, by putting the word concerning in there, to me, it sounds like you may not be the parent. I need more clarification on concerning parents, because parentage right there, it says, except for amendments, you took out the word due to parentage, concerning parentage. What, that doesn't really make any sense to me. I'm just trying to figure out what that means. Either you may not be the parent or you're concerned about the parent. I know it's a small word, but it's changing a statute. What does concerning parentage mean? Through you.
Senator Lesser.
Thank you, Madam Chair. And as I expressed before, under existing law, you can change a birth certificate if new information comes to light about your who your parents are. And this preserves that. There's no change to that except a grammatical change. Currently, it says due to parentage, and it just changes it to new information concerning parentage. But the upshot is the same. If you get new information about who your parents are, you can change your birth certificate to reflect that. 3 of you.
Representative Master Francesco.
Thank you. So I guess I take this as it doesn't have to be your parent, but you may have concerns and you don't have proof that you are concerned that there's a change there. That's the way I'm reading it. Okay, so moving on. Here, 113. On lines 1079, I guess they're just asking for the parent, if somebody wants to change the birth certificate, the parent needs to sign off on that for a replacement. Is that correct? Through you.
Senator Lesser.
So 1079 reflects a legally changed name of a parent if the parent changes their name. 3.
Representative Master Francesco.
Thank you. On lines 11, 12, section 17, that seems like to be a new section. Can you explain to me on lines 1127 through 1131, I guess, exactly what does that mean? Through you.
Senator Lesser.
Yes, thank you. That language defines gender incongruence through the 11th edition of the International Statistical Clarification of Diseases and Related Health Problems. 3 of you.
Representative Master Francesco.
Thank you. And what is gender incongruence? Can you give me a definition of that? What does that mean? I'm not familiar. 3 of you.
Senator Lesser.
That's on line 1128.
Through you, it's a condition as described in that manual, but it concerns an inmate's gender identity.
Representative Master Francesco.
So it's a condition of mixed gender identity. Did I hear that correctly? Through you.
Senator Lesser.
It concerns an individual's gender identity. 3 of you.
Representative Master Francesco.
Okay, I'm not even gonna talk about that. I guess I'll move on to again, we're talking about that term in lines 1157. What does that mean as a part when it comes to reproductive health services? Because you have it on lines 1157. It starts with reproductive health services includes all medical, surgical, counseling. So are you saying that the gender, how do you say that word again?
Incongruence.
Incongruence. Learn something new every day. How does that correlate to reproductive health services? Because it is in that section from 1151 to 1159 through you.
Senator Lesser.
Through you, that's a conforming change and just reflects the fact that we're updating a number of our statutes here to include in addition to treatment of gender dysphoria, also gender incongruence, and that's conforming and reflects the change we made earlier.
Representative Master Francesco.
Thank you. And that would include surgical procedures as well through you.
Senator Lesser.
Through you, I don't know the answer to that question.
Representative Master Francesco.
Thank you. I was just curious because it does say here in 1151, reproductive healthcare services includes all medical, surgical, counseling, and referral services related to human reproductive system. And I was wondering if that line that on 1157 also included surgical procedures, because it does talk about it in 1151 or in 1152.
Senator Lesser. He already stated he did not. Representative Master Francesco.
Thank you. Thank you, Madam Chair. So going down to lines 1193, gender affirming healthcare services. Again, we're putting that in there, that word in there as well. And I'm assuming, can you explain to me a little bit more about when they talk about a gender affirming healthcare services, what that entails through you?
Senator Lesser.
I think, Madam Chair, we're trying to just spell out language that's in existing law. So in existing law says gender affirming healthcare services means all medical care related to the treatment of gender dysphoria. And we're just pointing to places where they can, anyone looking to interpret that law can get guidance.
Representative Master Francesco.
Thank you, Madam Chair. Almost done. A couple more pages to go. I apologize, but this is all new language. It's not new. Okay, so on lines 1350. That's a new section there. It says gender affirming procedure means a medical procedure or treatment to alter the physical characteristics of a person diagnosed with gender dysphoria. Can you explain to me what, this is all a new section, what this section actually does to address those procedures through you, Madam Chair?
Senator Lesser.
Yes, thank you. So section 22 requires DSS to establish a working group to seek input on department guidelines for gender affirming procedures, at least 120 days before amending those guidelines. It defines gender affirming procedure. It requires a working group at least 90 days before amending guidelines, and requires ongoing reports to the Human Services and Public Health Committee.
Representative Master Francesco.
Thank you. So this is a new working group that is going to have 6 healthcare providers who treat persons with gender affirming procedures. Is this something in here or that would be covered under Husky through you?
Senator Lesser.
3 yes.
Representative Master Francesco.
Thank you. So our Husky Health Plan will cover procedures for gender affirming procedures that would paid for under Husky. Under which Husky is it through you?
Senator Lesser.
Through you, the working group established pursuant to section 22 just covers the Department of Social Services, and it's about seeking input on department guidelines. So that could be within the state's Medicaid program known as Husky. It could be other programs that are not traditionally referred to or covered by Medicaid. It's about the Department of Social Services in general. Through you.
Representative Master Francesco.
Thank you, Madam Chair. So our Husky program will cover procedures for gender affirming. It'll be paid for. Is that correct? The procedure that they have is going to be paid for through, I don't know which Husky plan, whichever it is, that'll be paid for through their Husky plan. The cost involved, the entire cost involved. Is that correct through you?
Senator Lesser.
I don't think I don't see that in section 22. I just see a working group just about DSS policies and procedures through you.
Representative Master Francesco.
Thank you. And I asked that because I asked if Husky was going to cover this. And I thought I heard you say that it does. We just didn't know what part of Husky. So what would Husky, if it's just a working group, what does Husky have to do with the working group at all? If it's just a working group through you?
Senator Lesser.
Through you, I think the only time Husky is referenced in this is just requiring that Husky health members be part of the working group through you.
Representative Master Francesco.
Thank you. Okay, so when you had mentioned before, I asked you if it was covered under Husky, you had said yes. That is incorrect. There will be no Husky coverage for any procedures at all. Is that correct? That's the intent of this section. It's just a working group, and our Husky plan will not be covering any procedures for that. Is that correct for you?
Senator Lesser.
I will try to be as clear as I can. The intent of section 22 is simply to establish a working group to seek input on department guidelines for gender affirming procedures.
Well, thank you.
Representative.
Thank you. That's doesn't really answer my question because it's guidelines, and that always scares me, but I don't have any further questions at this point. I thank you for going through all this. I think it's very important. It's a big bill. I know it may change when it comes to the floor, but I think it's important that people understand it. And that's it. Thank you, Madam Chair. I have no further questions.
Thank you, Representative. Representative Ferraro.
Thank you, Madam Chair. And I just have a few questions and maybe some general comments. To begin with, this bill seems to duplicate bills we already have in the pipeline here in Human Services, as well as a governor's bill. I was wondering how much of this bill is duplicitous, and why do we feel it necessary to rehash things that are in other bills through you, Madam Chair?
Senator Lesser.
Thank you, Madam Chair. First, I will just say that none of the bill is duplicitous. Some of it may be duplicative. The duplicative parts, I would just say we have portions of other bills that cover community health workers. We also have provisions that have to do with expanding the Covered Connecticut program. And we've got bills dealing with prescription drugs and also the social work component that we've discussed. So those are present in other bills. I can't speak to the genesis of it other than this was a bill proposed to us by the Senate Democratic leadership, and certainly we are paying attention to other bills and don't want to duplicate work, but sometimes bills are combined, as you know, a representative, or moved apart for a variety of reasons, some of them strategic and some of them just reflecting a caucus's priorities. Through you.
Representative Ferraro.
Thank you, Madam Chair. And through you, I do appreciate the good senator's correction of my language. I'm only a karate instructor posing as a state rep. So moving on, I find this bill to be more punitive than helpful, and in that, penalties for this and penalties for that. An example, the part where there's a maximum, fair market value, and the Federal Inflation Reduction Act. There's a penalty if the drug company decides to pull the drug from the market. And what I see here is what you're asking. I mean, it almost makes me wonder how we have the right to even do this, because in this country, we have, the right or the freedom, liberty to run our companies the way we want. And if a drug is that is in our portfolio as a drug company is losing money, one, we're forcing this company to continue supplying this drug at a loss. We're not providing them with a method to make them whole. And then should their board of directors turn around and say, you got to get out of the market with that drug, I mean, it's our company can't sustain it. And the next thing you know, we're gonna fine them $500,000. I just find it to be overly punitive, and I'd like the good senator to maybe give us some commentary on why he thinks this is a good policy.
Senator Lesser.
Thank you. And I think the answer through you, Madam Chair, is that it is outrageous that in this country and in this state, we are paying by far the highest prescription drug prices for the world. Our friends in Canada and Europe and Asia get the same exact drugs that we do. But residents of this state, seniors in this state, are subsidizing those folks by paying artificially high prices. And we love drug innovation and we love development, and we are grateful for the great work that our friends in the pharmaceutical industry provide. But paying the highest prices in the world is not acceptable. And this is something that I will say that presidents of both parties have sounded the alarm about. It is an outrageous state of affairs. And so what we're saying is we're not picking a unreasonable policy. We're saying that we're going to tie ourselves to the same prices that Medicare is going to be paying, should be the same prices that everyone else pays. Certainly you can pay less than that, but we shouldn't be paying more than those negotiated prices through you, Madam Chair.
Representative Ferraro.
Thank you, Madam Chair, and I thank the good senator for his answer to that question. I do happen to disagree. The cost of drugs, yes, certainly is very high in this country, but so is the cost of regulation and R&R. I mean, research R&D, excuse me. And maybe some of the government restrictions and requirements that are put on these drug companies can be looked at to maybe assist a drug company, or since we're in the business of subsidizing so many other industries, maybe some of these expensive essential drugs that this bill is going to dictate are essential and must be continued, even if the company's losing money, then maybe subsidies should be applied to those drugs. All I'm saying is that it's one way, this bill, it's very punitive on some of our companies. And I do think that if I was a drug company looking to expand my operations, I really have to think twice about going to Connecticut. I do have another question regarding the $250 filing fee for changing someone's name through the probate court. Does this $250 waiver apply across the board to everyone or only to particular groups through you?
Senator Lesser.
It's that you're asking through you, Madam Chair, about section 21 of the bill.
Representative Ferraro.
Yes, I believe so. Yes.
Senator Lesser.
Let me pull up section 21 of the bill.
It basically says it removes the $250 filing fee to change someone's name through the probate court.
Yes, it does. Through you.
I'm sorry.
Representative Ferraro.
I'm sorry, I didn't hear that.
He said, yes, it does. Senator Lesser, do you want to?
So just for clarification, it doesn't matter what group you belong to. If you have a desire to change your name, that fee is removed. So that basically that is repealed. That is no longer in statute. Is that correct?
Senator,
According to this bill.
Senator Lesser.
Yes, we are trying to save the residents of the state $250 when they change their name. Through you.
Representative Ferraro.
Okay, thank you very much. And the other thing I would like to bring up is in the public hearing, there was some support for the bill with regards to the healthcare advocates and Office of Child Advocate, Office of Health Strategy, Connecticut Legal Rights, Mental Health Connecticut, Action Group, ARC, Connecticut Citizens, etc. I also noticed that it was opposed by a great deal of entities, the DSS being one of them, Office of Probate Court, Pharmaceutical Care Management Association, CBIA, Bioscience Growth Council, Pharma, Greater New Haven Chamber of Commerce, Biotechnology Innovation Organization, Connecticut Hospitals Association, Connecticut Rear Action Network, National MS Society, Stanford Health, Disability Rights Connecticut. Seems to be an awful lot of folks representing large bases of constituents that are opposed to the bill. And so it can't be that a bill of this size would be able to have everything for everyone. I understand that. And that's one of the reasons why I really don't like large, almost aircraft carrier type bills, for this reason, that it makes some people happy, it makes some people unhappy, and it's impossible to make everyone happy. But that's the nature of the beast. And I would just like to say that I'm going to have a very difficult time supporting this bill for the reasons that I discussed. I would like to see some of these things maybe introduced in smaller bills, and some of these things I'd like to see not introduced at all. But thank you, Madam Chair.
Thank you, Representative. Any other Senator Seminara?
Thank you, Madam Chair. I just wanted to make one quick comment and then also wanted to ask a question. My comment is, once again, I think we discussed this earlier, and a great deal of this bill belongs in insurance, I feel. So I don't think we should be entertaining that here. But my question for the good senator is this bill in an effort to get closer to single payer healthcare system?
Senator Lesser,
Through you, Madam Chair, no.
Senator Seminara,
It is not in an effort to get closer to a single payer healthcare system?
Senator Lesser,
Through you, Madam Chair, that is correct. It is not.
Senator Seminara.
Thank you.
Any other questions or discussion from members of the committee? Representative Dathan.
Thank you very much, Madam Chair. And just have a couple quick questions for the senator who is discussing the bill, if I may.
Go right ahead.
Thank you very much. Just wanted to understand, I know there's been some discussion about the 2 licensed clinical social workers as part of section 10 of this bill. Could you please talk about that? Because I know there's a large financial implication for that.
Senator Lesser,
Yes, thank you. And as I spoke previously, the bill currently requires DSS to include at least 2 licensed clinical social worker visits in the fee schedule for people enrolled in the CHCPE or any HCBS waiver administered by DSS. But I would also say that it's our intent to remove section 10 in a subsequent version of the bill. 3 of them.
Representative Dathan.
Thank you very much for clarifying that. We talk in sections 11 and 12 about this community health workers. I just wanted to get an understanding what sort of services would these community health workers be providing to members in the Husky community through you?
Senator Lesser,
They could be coordinating medical, oral, and behavioral health care services and social supports, connecting to and navigating health systems and services, prenatal, birth, lactation, and postpartum supports, health promotion, coaching, and self-management education. 3 of them.
Representative Dathan.
Thank you very much. And through you, Madam Chair, how is the payment going to be made for these community health care workers? Is it going to be value-based, or is it going to be payment for services through you?
Senator Lesser,
Through you, Madam Chair, the language of the bill does not specify, does not limit the specific payment models. I will just reference the comments that I made previously that indicated our desire to move towards or to incorporate language that we're currently substituting on Senate Bill 991 that limits the ability of DSS to engage in certain value-based contracts, but does not direct them to do that or fee for service. 3 of them.
Representative Dathan.
Thank you very much. Yeah, I do have a little bit of concern about value-based payments, particularly around behavioral health issues. As we know, not everybody's path is the same, and I'm really curious how we are going to address this. I do very much support community healthcare workers, and I do believe that they offer such a great impact to our Husky community, and I'm very supportive of moving this forward. And I'm want to follow how this will evaluate going forward. I had a couple additional questions on other parts of the prescription pricing bill, if I may, Madam Chair, through you.
Go right ahead, Representative.
Thank you very much. I'm wondering what we have to prevent sort of certain medications not being authorized for folks as a result of not being able to be negotiated as part of any sort of fixed prescription drug plan. And I'm just wondering if there's any sort of negative side effects of, an individual who might be thriving on better medication, but because of lack of negotiated cost, they're not eligible to receive that under Husky, and therefore may have some adverse health implications as a result of this. How does the bill address that through you?
Senator Less.
Thank you. And just a clarification question through you, Madam Chair. Is the gentlelady asking if a bill was be withdrawn from the market because of being covered, try to avoid the provisions of this bill? Through you.
Representative Dathan.
Actually not being removed from the market, but being removed from the list of accessible medications used by an individual who might be utilizing those medications. But because the Office of Healthcare Strategy wasn't able to negotiate certain pricing for that, then the individual taking that medication would no longer be able to use that medication and only be able to be using another medication that has been given this preferential pricing for you.
Senator Lesser.
Thank you, Madam Chair. And I just hope I can clarify that through you, the Office of Health Strategy is not going to be negotiating prices under this bill. It's simply depending on which section the gentlelady is referring to, the state could set a maximum fair price, but that wouldn't be a negotiation that would take place in the Office of Health Strategy. It wouldn't be a negotiation, period.
Representative Dathan.
So if a negotiated price for a certain medication is not achieved and we have Husky recipients on that medication, is there anything in the bill that prevents Husky reimbursement for bills that haven't been favorably negotiated or favorably priced within the caps contemplated by this bill?
Senator Lesser.
I apologize. I'm not sure I understand the question.
Representative Dathan, can you rephrase?
Yeah, apologies if I'm not explaining myself. My concern really is if someone is on a certain medication, let's say it's for diabetes, and it is to regulate blood sugars, and this is sort of a standard sort of medication, and unfortunately, there's not been, it doesn't fall within the capped pricing of the contemplated regulations in this bill. Does that mean that the recipient of this medication would have to move to another blood sugar stabilizing medication that wasn't priced capped, that was price capped as part of this bill? I'm just worried we have people having to switch medications to something that might not be as good for them just because it's not part of the price capping feature of this bill. Through you.
Senator Lesser.
Yeah, I think that's a good question. Nothing in the bill speaks to drugs that are not covered by by the negotiations. So certainly, if your question pertains to Medicaid recipients, we generally get a pretty good discount for Medicaid drugs. I'm not aware of any attempt to steer Medicaid recipients, for example, to other drugs. But certainly, if that happens, we can address that. The bill does not speak to try to change folks' formularies through.
Representative Dathan.
Okay, that's super helpful. I am concerned that some of the aspects of this bill really do seem to be part of outside of the scope of the Human Services Committee, and I think would need to be part of the sort of insurance committee's review. Just to move on to another quick section regarding some of the updates to folks who have want to change their birth certificate and things like that. Again, I that's kind of outside the scope of this committee. Will this section be seen by the General Law Committee through you?
Senator Lesser.
Through you, we are referring this bill to the Appropriations Committee. I can't speak to what the screening committee could do, what other committees it could look at it, but certainly there's an appropriations question there, and they're getting the first crack at it through you.
Representative Dathan.
Thank you very much. I will be voting in favor of this bill today, but I do have quite a large number of concerns coming out on the fiscal side of this bill. I do support the intent to lower the prescription drugs in our state. And I believe that we need to do that. I'm hoping that we find within the sort of fiscal analysis of this actually could potentially save money to the state for drugs that are purchased through the Husky program. And I do hope that we endeavor to have more transparency in our healthcare costs. And I do support the community-based health workers. So thank you so much, and look forward to continuing the dialogue through you.
Thank you, Representative. Representative Butler, go right ahead.
Excuse me. Thank you, Madam Chairman. Representative Dathan actually covered many of the areas of concern that I had. I know this is going to the Appropriations Committee, and certainly whatever fiscal note comes out of that is going to be a great concern. The bill has a lot of sections, and I know that with my experience over years, that the bill that we actually see make it to the floor can actually be vastly changed than what we're looking at today. I have concerns about some of the criteria of some of the other sections, including the birth certificate section. I'm willing to actually vote for this to come out of committee, but I really think that I'd like to see some of the areas actually worked on to actually further define some of these provisions and the cost and criteria in certain aspects and certain sections of concern. I hear that and understand that they may be worked on. So from that point of view, I'm going to support this today, but when you have a bill with so much in it, it just lends itself to the concern that you probably heard by some committee members here today, but I will vote to get it out of committee so people can work on it and actually make it, and especially the areas that are really good, to actually make sure that they're not compromised and actually provide the good benefit to the residents that are in those sections. So thank you, Madam Chair. I just wanted to voice my opinion. I know there's areas of concern, and when you have a bill this large, that's, a tendency, and just the way that things play out in certain committees and certain large bills. So, but I will be supporting it today. Thank you, Madam Chair.
Thank you, Representative Butler. Any further conversation or discussion? Representative Bugby, followed by Representative Cook.
Thank you, Madam Chair. I'd just like to follow up on the comments made by my good friends from New Canaan and from apparently San Francisco.
Western Connecticut.
Quite Western. And I do appreciate the view. I guess the question, the fiscal concern comes to mind, and I know there's no fiscal note attached to this yet, and it's going to appropriations. I'm just curious if we have a ballpark. Do we have a neighborhood, something where we can get an idea of how much this might be going to cost the people of the state?
And my apologies, Representative Buckby. Senator Lesser.
I don't have a fiscal note for the entire bill. We've looked at specific pieces, but we'll get that. We'll certainly have a preliminary fiscal note before it's acted upon in appropriations. For you.
Representative.
Thank you for that. And thank you for the correction. It's a regular thing that Representative Boyd does to me on a regular basis. It's usually Buckabee, though. He throws an A in there. So I hear different variants of my name on a regular basis, but no concerns. Yeah, I mean, I think that's kind of the concern for me, is that we don't have any projection on what this is. So we need it to pass out of committee, not knowing what it's going to cost, but then find an answer after we vote on it. So that concerns me. I also want to agree with my colleagues on, I think there's a lot of this, and maybe not all pieces, because it is such a heavy lift. Maybe not all pieces belong in insurance, but certainly a good majority of it does. So for those reasons, I can't support taking it out of committee at this point, but certainly look forward to hearing what those numbers may be at some point. Thank you, Madam Chair.
Thank you, Representative Buckby. Any other further conversation or questions? Seeing none. Oh, Representative Cook.
Thank you, Madam Chairman. Madam Chairman, I appreciate all of our colleagues' conversations across this topic. And I think that part of the frustration that I have is I don't disagree. A good amount of this absolutely does belong in insurance. And I also know that it does belong in appropriations. So my question would be for the proponent of the legislation would be, does he see this having, if it goes to the appropriations committee, does he see this having a referral to the insurance committee at some point during this path that we have through you?
Senator Lesser.
Through you, Madam Chair, I don't serve on the Senate Screening Committee or the House Screening Committee for that matter, so I don't have a say in that. I did think that the most important question is the fiscal note, which Representative Buckby just referenced, which is why we're referring it to appropriations to see what the budget can support. Through you.
Representative Cook.
Thank you, Madam Chairman. So the good senator thinks that it should do appropriations first, so we have a fiscal note before it would ever get a referral, if it needed a referral to the insurance committee. Through you.
Senator Lesser.
Yes, we're supporting a referral to the Appropriations Committee. Where it goes after that, above my pay grade. Through you.
Representative Cook.
Okay. So I would love to see insurance have this piece of legislation. I think it's vitally important, but I would also love to see the Appropriations Committee have this. I think it's vitally important that we really dig into what's happening here. I also recognize that we are in fact a policy committee, not a financial committee, which in some cases truly frustrates me. But in other cases, I respect the process. There are some things in here that I can support. There are some things in here that I absolutely can't support. But for the sake of the process, I will go ahead and support it, but I would also offer that I think it's vitally important that both of those committees that I just referenced, for the sake of us not being here till next week, get this bill at some point so they can digest it as well. So thank you, Madam Chair.
Thank you, Representative. My apologies for forgetting I had said you'd be second. Any other questions or comments? Now seeing none, would the clerk please call the roll?
Item 1 on the agenda, SB 10, an act promoting access to affordable prescription drugs, healthcare coverage, transparency and healthcare costs, home and community-based support for vulnerable persons, and rights regarding gender identity and expression. Motion for a JF2 approves. Representative Gilchrist,
Yes.
Senator Lesser.
Yes.
Senator Seminara,
No.
Representative Case,
No.
Senator Gaston,
Senator Gaston, yes.
Representative Dathan,
Yes.
Senator Mar,
Senator Mar votes yes.
Representative Butler,
Representative Butler votes yes.
Representative Cook, Representative Exum, Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson, Representative Kit, Representative Leeper.
Representative Kit votes yes.
Thank you, Representative. Representative Santiago,
Santiago votes yes.
Representative Buckby,
No.
Representative Ferraro,
No.
Representative Mastro Francesco,
No.
Representative Pizzuto,
No.
Representative Paletta,
Rep. Paletta votes no.
Representative Exum.
Representative Exum votes yes.
Thank you, Madam Chair.
Thank you, Madam Clerk. We will be holding the votes open and we'll announce later on, depending on how the meeting goes, when they will be held open until. Moving to the next item, Senate Bill 411, an act concerning Medicaid reimbursement for pharmacists dispensing blister pack medications. Can I have a motion?
So move.
Second.
And this is a JF2 approps. We discussed this before drafting at one of our last meetings. And so what this bill does is it increases the dispensing fee by $5 for pharmacists dispensing 90-day prescriptions in blister packs. Conversation or questions? Representative Case.
Thank you, Madam Chair. And I do say we had some really good conversations on this, and I think this was a conclusion to some compromise, and I look forward to passing it forward so that we have a compromise, and it was a great bipartisan working together. So thank you.
Thank you, Representative Case. Yes, Representative Dathan.
Thank you very much. And I appreciate the conversations that we have had on this. I do have some concerns, but I do want to keep the conversation going and see what comes out of approach with the fiscal note. If it is a cost savings because we are getting those 90 days prescriptions versus the 30 days, I think that that's a good move forward. So I'd like to keep the conversation going. So thank you very much.
Thank you, Representative. Further questions or comments? All right, seeing none, would the clerk please call the roll?
Item number 2 on the agenda, SB 411, an act concerning Medicaid reimbursement for pharmacists dispensing blister pack medications. Motion for a JF2 approps. Representative Gilchrist,
Yes.
Senator Lesser, Senator Seminara,
Yes.
Representative Case,
Yes.
Senator Gaston,
Yes.
Representative Dathan,
Representative Dathan is yes.
Senator Mar,
Senator Mar is yes.
Representative Butler,
Representative Butler votes yes.
Representative Cook, Representative Exum,
Exum votes yes.
Representative Fortier,
Representative Fortier is yes.
Representative Hughes,
Representative Hughes is a yes.
Representative Johnson, Representative Kit,
Representative Kit votes yes.
Representative Leeper,
Yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
Yes.
Representative Ferraro,
Yeah, yes.
Representative Mastro Francesco,
Yes.
Representative Pizzuto,
Yes.
Representative Paletta,
Representative Paletta votes yes. Representative Paletta votes yes.
Thank you. Thank you, Madam Chair.
Thank you, Madam Clerk. And as I mentioned, we will hold the votes open. Moving on to item 3 on our agenda, Senate Bill 991, an act concerning Medicaid reimbursement for community health workers. Do I have a motion?
So moved.
Do I have a second? Do I have a second?
Rep Hughes, second.
Great. Moved by Senator Lesser, seconded by Representative Hughes. So as we discussed in the conversation on Senate Bill 10, Senate Bill 991 is asking the Department of Social Services to move forward with Medicaid coverage for community health workers. Community health workers are a vital piece of the healthcare community in that they can, it has been shown that they can address disparities, in particular racial disparities in access to healthcare. Senator Lesser.
Yes, thank you, Madam Chair. I just want to highlight, and this was discussed briefly previously, that at lines 14 to 16 of the substitute language, it just requires that the contracts with the Commissioner of Social Services, and I think this speaks to a point raised by Representative Dathan earlier, do not provide financial incentives for other providers to limit access to such community health workers. And it's my understanding that the inclusion of that language satisfies the concerns we heard in the public hearing from members of the provider community and advocates for people with disabilities. Through you, Madam Chair, hopefully we can build broad support for this bill.
Thank you, Senator. Yes, Representative Case.
Thank you, Madam Chair. I know it's been referenced. So in section 11 of SB 10, is this the same language through you?
It is not the same. There is a change between Senate Bill 10 and Senate Bill 991. And Senate Bill 911 has the language that advocates in the field have agreed to. Representative Case.
Yeah, and I'm trying to read through it in section 11. It looks pretty much might be one or two words difference, but I'm just curious. There's two bills here that look like they're into Senate Bill 10, and I'm curious why we're doing things that are in one bill and then trying to pass sort of the same language out in another bill. I'll leave it at that, and I can't support it because of it.
Thank you, Representative. Any further questions or comments? Check Zoom. Okay. All right, seeing none, would the clerk please call the roll?
Item number 3 on the agenda, an act concerning Medicaid reimbursement for community health workers, motion for a JFS to the floor, LCO number 6200. Representative Gilchrist,
Yes.
Senator Lesser,
Yes.
Senator Seminara,
No.
Representative Case,
No.
Senator Gaston,
Yes.
Representative Dathan,
Yes.
Senator Marr,
Yes.
Representative Butler,
Representative Butler votes yes.
Representative Cook, Representative Exum,
Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson, Representative Kit,
Representative Kit votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
No.
Representative Ferraro,
No.
Representative Mastro Francesco,
No.
Representative Pizzuto,
No.
Representative Paletta.
Rep. Paletta votes no.
Thank you, Madam Chair.
Thank you, Madam Clerk. We will continue to hold the votes open. Moving forward to number 4 on our agenda, Senate Bill 1053, an act establishing a task force to study and make recommendations concerning the elderly nutrition program. This is a JF to the floor. Do I have a motion?
So moved.
All right, moved by Senator Lesser, seconded by Representative Cook. This bill, as it says, establishes a task force to study elderly nutrition programs. Included in the requirements for this task force, they'll study eligibility requirements, types of meals provided, cost of meal preparation and delivery, number of program participants compared to estimates of people who need services, adequacy of funding levels, and the process for contracting with elderly nutrition service providers. We've heard from folks in the field that depending on where you live in the state, there are access issues. Representative Case. You were giving me the look.
Thank you, Madam Chair. So a quick question. I know Representative Cook had a similar bill out, I believe 2 years ago. And where do we end up with that task force through you?
I don't know. I'm gonna look to the, She is shaking her head. Okay, Representative Cook?
Thank you, Madam Chairman. So through you, the questions that are being the group on this task force, and we heard that we heard our Commissioner of Aging said that we didn't necessarily need this, but yet and so Representative Case will, and I will reference our local senior center. Joel has been very adamant that this is something that's so vitally important, and this looks at something different than what we did a few years ago. And what this ends up doing, I'm going back to refer because obviously today's been one of those crazy, crazy days. This kind of brings us outside of the group that was working to look at some other issues and takes it down a different path. And the senior center folks that are really on the ground doing this has gotten behind this and asked that we do this, feeling that the group that is already in place has one agenda and they would like the agenda to be expanded. And this is why this was so vitally important. And I'm hoping that in some respects answers the good representative's question.
Thank you, Representative Case.
Thank you. And my only concern is, this is a population that we all want to work with, and I see that the appointments are a little bit different than the last one, and this is 6-2 appointments by party line. Is there a reason for that? Through you?
Good question, Representative. I don't believe so. Let me look to the language. There are in lines 26 through 28 and in lines 29 through 31, the minority leader of the House and the minority leader of the Senate do have appointments as well.
And I understand that. Oh, thank you, Madam Chair. And I understand that. And I understand those are the two, but the others are 6. And I just, with this type of population, we'd like to work together and almost like to see if chairs or rankings would want to be on this, because this is something that we need to get across the board and we need to get action on. And we had this pass out of the House, I believe the Senate too. And given what we went through with the past 2 years, it just didn't go forward on it. So through you.
I don't foresee a problem in continuing the conversation on this to make sure the appointments are more equitable. Representative Cook?
Thank you, Madam Chairman. I haven't seen the appointments. We actually just asked for the task force. We did not necessarily set the appointments. I would ask that if we have commitment from both sides of the aisle in this conversation, that we just hold this for a few minutes, maybe a half an hour. I'm sure we'll still be here, and maybe try to balance out the appointments. And so we can actually take action on it. And I think that might be friendly. Through you?
Yeah, that works. Let me ask LCO, can we hold the bill and come back to it now that we did a motion in a second?
Yes. How long are you planning on being here?
How long do you need to do?
Madam Chair.
Yes, Senator Les.
I was just curious if I could ask a question through you of Representative Case.
Yes, go right ahead.
Do you have a specific recommendation or specific ask for the committee membership? Through you?
The thought and the recommendation was to have some leadership or something from this committee on here, so that Representative Cook has something different, but I mean, I'd like it to be done today, and she would like it to be done today. I have no problem getting this out and working on it and get it to the floor, but that's up to you guys. I just think that we have a vested interest. It's been 4 years. We want to get something done.
If Representative Cook would be amenable, I would love if you can work with Representative Case. We get this out today and continue to work on it and do a change on the floor. Representative Cook?
My question for you is, are we meeting on Thursday?
We are meeting on Thursday.
Could we work on it till Thursday and bring it back up for Thursday? As long as that way if we're all in agreement of this, then that gives our LCO folks an opportunity. And at the same time, we know that we're working collaboratively on this, and then we shouldn't have an issue on Thursday. but we want to make sure that we do have folks. I mean, obviously, we know that members of our leadership on both sides could appoint somebody. But I think that it's important that we look at those appointments.
That works for us. We will hold this bill and come back to it on Thursday.
I think we're going to have to do a withdrawal on our motions now as well.
Yes. Okay.
I will withdraw.
Let me just check. Okay. All right. So Senate Bill 1053 has been withdrawn by Representative Case and Representative Cook, with plans to come back to it on Thursday. Thank you. Moving on to number 5 on the agenda, Senate Bill 1110, an act concerning various revisions to the Department of Social Services statutes. This is a JFS to the floor. Do I have a motion? Is there a second?
Second and Rep. Hughes.
Motion by Senator Lesser, seconded by Representative Hughes. This bill came to us from the Department of Social Services. It does a variety of things. The S language that you have in front of you deletes a provision that would have eliminated an annual Medicaid waiver report. It limits the use of alternative payment methodologies, and it addresses LIHEAP, which I know has been a major conversation in this committee. And so what the provisions in the substitute language do is says that fuel vendors would be paid within 10 days in the LIHEAP program. Vendors would have an opt-in for electronic payments and electronic submissions of authorized fuel slips. The regional rack pricing would be used rather than the New Haven rack pricing alone. And there would be a discount off retail price and payments based on fuel price on date of delivery. Any questions or conversation? All right, seeing none, would the clerk please call the roll?
Item number 5 on the agenda, SB 1110, an act concerning various revisions to the Department of Social Services statutes. Motion for a JFS to the floor with LCO number 6232. Representative Gilchrist,
Yes.
Senator Lesser, Senator Seminara,
Yes.
Representative Case,
Yes.
Senator Gaston,
Yes.
Representative Dathan, Senator Marr,
Yes.
Representative Butler,
Representative Butler votes yes.
Representative Cook, Representative Exum,
Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson, Representative Kit,
Representative Kit votes yes.
Representative Leeper, Representative Santiago,
Santiago votes yes.
Representative Buckby,
Yes.
Representative Ferraro,
Yes.
Representative Mastro Francesco,
Yes.
Representative Pizzuto,
Yes.
Representative Paletta.
Rep. Paletta votes yes.
Thank you, Madam Chair.
Thank you, Madam Clerk. The votes will be held open. Moving next to item 6 on our agenda, Senate Bill 1173, an act concerning the Department of Social Services. This is a JF to the floor. Do I have a motion?
So moved.
Is there a second?
Second,
Great. Moved by Senator Lesser, seconded by Representative Fortier. This bill is what we refer to as a placeholder in this building and in this work. Issues may arise later on, or issues we've discussed may come back and need a spot to go. And so that is the intention of this bill. Any conversation or questions? Senator Seminara.
Thank you, Madam Chair. I just was going to confirm that this is a placeholder. So thank you for clarifying that.
You're welcome. Any other questions or comments? If not, would the clerk please call the roll?
Item number 6 on the agenda, SB number 1173, an act concerning the Department of Social Services. Motion for a JF to the floor. Representative Gilchrist.
Yes.
Senator Lesser,
Yes.
Senator Seminara,
No.
Representative Case,
No.
Senator Gaston,
Yes.
Representative Dathan. Senator Mar,
Yes.
Representative Butler,
Representative Butler votes yes.
Representative Cook, Representative Exum,
Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson, Representative Kit,
Representative Kit votes yes.
Representative Leeper, Representative Santiago,
Santiago votes yes.
Representative Buckby,
No.
Representative Ferraro,
No.
Representative Mastro Francesco,
No.
Representative Pizzuto,
No.
Representative Paletta.
Rep. Paletta votes no.
Thank you, Madam Chair.
Thank you, Madam Clerk. Moving next to item 7 on our agenda, Senate Bill 1175, an act concerning medical assistance. This is a JF to the floor. Do I have a motion
So moved.
and a second?
Rep Hughes, seconds.
Moved by Senator Lesser, seconded by Representative Hughes, as was mentioned in the previous agenda item. This too is a placeholder. Any questions or conversation? Representative Mastro Francesco.
Thank you, Madam Chair. I'm just curious what the purpose is for a placeholder. We've been in committee for a while. I'm just curious why we have a placeholder through you.
Most committees do have these bills as issues might arise, or there was something that was overlooked. It would be something that could then go into the placeholder. We would certainly discuss it with our rankings. Representative Mastro Francesco.
Thank you. So I'm assuming that if this was a placeholder bill, something went in it, it would not have a proper public hearing through you.
Not necessarily. There may have been a public hearing on the topic itself, maybe a subject matter public hearing, but potentially in some instances, there wouldn't have been.
Thank you. Thank you, Madam Chair.
You're welcome. Any other questions or comments? Representative Cook.
Thank you, Madam Chairman. If you don't mind, through you, I'd like to just to kind of address the question, but from the good representative across. Sometimes we pass pieces, like we'll pass an entire piece of legislation out of the committee and pieces of it get lost. Whether, you know, we put something that we really like in something that has a fiscal note to it and the appropriations can't raise the fiscal note, so the entire bill dies. So the reason for a placeholder, although I would argue maybe we don't need two, but either way, the reason for that would be possibly if there was something that's attached to a fiscal note. So you have a bill that's 30 pages and there's a financial component that goes to appropriations. That whole bill can die, but we still need to keep part of that, and the financial part would, in essence, find its demise in the appropriations committee. So that would be the reason for a placeholder, so we can actually save some of the good work that we're trying to do in case it gets lost somewhere else. Through you, Madam Chair.
Thank you, Representative. Okay. Don't see any further questions or comments. Would the clerk please call the roll?
Item number 7 on the agenda, SB 1175, an act concerning medical assistance, motion for a JF to the floor. Representative Gilchrist.
Yes.
Senator Lesser,
Senator Lesser, yes.
Senator Seminara,
Senator Seminar, no.
Representative Case,
No.
Senator Gaston,
Yes.
Representative Dathan, Senator Mar,
Yes.
Representative Butler,
Representative Butler votes yes.
Representative Cook, Representative Exum,
Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson, Representative Kit,
Representative Kit votes yes.
Representative Leeper, Representative Santiago,
Santiago votes yes.
Representative Buckby,
No.
Representative Ferraro,
No.
Representative Mastro Francesco,
No.
Representative Pizzuto,
No.
Representative Paletta.
Rep. Paletta votes no.
Thank you, Madam Chair.
Thank you, Madam Clerk. Moving on to number 8 on our agenda, Senate Bill JF02, an act concerning prescription drug affordability. This is a JF to the floor. Do I have a motion? Is there a second?
Refuse, go ahead, Hilda.
No,
I'm
Repres-
waiting for discussion.
got it.
Oh.
But Representative Fortier, yeah, motion, it was moved by Senator Lesser and seconded by Representative Fortier. Is there conversation or discussion? Senator Lesser?
Yes, thank you, Madam Chair. I just want to be clear. This language is similar, if not identical. I believe it's identical to language in sections, the first part of section Senate Bill 10. Three.
Thank you, Senator. Any other? Yes, Representative Cook, followed by Representative Dathan.
Thank you, Madam Chair. So to the good senator, could he please explain why, if this is identical language to the other Senate Bill 10, why we're doing this in a separate piece of legislation? Three.
Senator Lesser?
Thank you. Actually, it's very similar to the point that I think the good representative just made, which is that sometimes bigger bills go down or run into obstacles, and we wanted to preserve the opportunity to have a specific conversation about prescription drug affordability, regardless of whether it's in or out of SB 10. Obviously, we will not pass two bills on this topic, but wanted to give us maximum flexibility about where the vehicle should go. Three.
Representative Cook?
Thank you, Madam Chair. So then my next question would be, given the fact that this is about insurance coverage, should this not go to insurance?
Senator Lesser?
Through you, as the parts of SB 10, this bill affects all payers of the state, including the state's Medicaid program. It'll cover all payers. State's Medicaid program, private insurers, ERISA plans that are not regulated by the Connecticut Department of Insurance. So it covers a variety of different payer types. It's unclear at this point whether there'll be a fiscal note, which is why we're sending it to the floor, not to appropriations. But once it hits the floor, it'll probably go through a long circuit of committees. Through you.
Representative Cook?
Through you, madams. I do believe that this should go through insurance. We gave a pass on the other one, so I would make a referral that this goes to insurance.
So is it a motion? A motion?
I make a motion that this bill goes to insurance.
Okay,
If we gave a pass for the other one, I think this one should go.
So Representative Cook has made a motion, and Representative Case has seconded. We will stand at ease. All right, I'd like to call the Human Services Committee back to order. To refresh everyone, we are on Senate Bill 1202, and there is a motion on the table by Representative Cook, seconded by Representative Case, to refer Senate Bill 1202 to the Insurance Committee. Any discussion or comment on that motion? Representative Dathan.
Thank you. Just wanted to echo my colleague, Representative Cook's concern that this is an insurance bill rather than a Medicaid related bill. So thank you so much for bringing up that. I was going to mention the same thing. Thank you very much, Madam Chair.
Thank you, Representative. Any further question or comment? Hearing none, would the clerk please call the roll on the motion to refer Senate Bill 1202 to the Insurance Committee? A JF.
Item number 8 on the agenda, SB 1202, an act concerning prescription drug affordability. Motion to amend the motion to JF to the floor to JF2 insurance. Representative Gilchrist,
Yes.
Senator Lesser.
Yeah.
Senator Seminara,
Yes.
Representative Case,
Yes.
Senator Gaston,
Senator Gaston, yes.
Representative Dathan,
Yes.
Senator Marr,
Senator Mar, yes.
Representative Butler,
Representative Butler votes yes.
Representative Cook, Representative Exum,
Representative Exum votes yes.
can you repeat that one more time, just so we,
Representative Exum votes yes.
thank you. Representative Fortier,
Representative
Fortier
votes yes.
Representative Exum votes yes.
thank you, Representative Exum. Representative Hughes,
Representative Hughes votes yes.
Representative Johnson, Representative Kit,
Representative Kit votes yes.
Representative Leeper, Representative Santiago,
Santiago votes yes.
Representative Buckby,
Yes.
Representative Ferraro,
Yes.
Representative Mastro Francesco,
Yes.
Representative Pizzuto,
Yes.
Representative Paletta.
Rep. Paletta votes yes.
Thank you, Madam Chair.
Thank you, Madam Clerk. And now, as confusing as this may seem, we will vote on the, oh, yes, good point. We should announce the tally. Madam Clerk, can you please announce the tally on the motion?
Voting 21, the yeas are 20, absent and not voting 1.
Thank you, Madam Clerk. The motion passes. So now we have before us Senate Bill 1202 with an amended motion, a JF to the Insurance Committee. Is there further conversation or questions? We voted on the motion to change where it was going. Now we're going to vote on the bill. Okay. All right. Seeing no questions or comments, would the clerk please call the roll? For 1202 with a JF to the Insurance Committee.
Once again, item number 8 on the agenda, SB 1202, an act concerning prescription drug affordability, JF2, motion for a JF2 insurance. Representative Gilchrist,
Yes.
Senator Lesser, Senator Seminara,
Yes.
Representative Case,
Yes.
Senator Gaston,
Yes.
Representative Dathan, Senator Marr,
Yes.
Representative Butler,
Representative Butler votes yes.
Representative Cook, Representative Exum,
Representative Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson, Representative Kit,
Representative Kit votes yes.
Representative Leeper. Representative Santiago.
Santiago votes yes.
Representative Buckby.
Yes.
Representative Ferraro.
Yes.
Representative Mastro Francesco.
Yes.
Representative Pizzuto.
Yes.
Representative Paletta.
Rep. Paletta votes yes.
Thank you, Madam Clerk. And as was mentioned earlier, we will hold the votes open. Next, we'll move on to item 9 on the agenda, Senate Bill 1203, an act concerning medical debt. This is a JF to the floor. Do I have a motion? Is there a second?
Rep Hughes seconds.
Motion by Senator Lesser, seconded by Representative Hughes. This bill addresses hospital financial assistance, and looks at the ever-growing need of medical debt here in the state. Any questions or comments? Representative Case.
Thank you, Madam Chair. So looking through this bill, if you go through, I'll give an example, line 24, 25, does this bill not be overseen by the Office of Health Threat Strategies through you?
Thank you, Representative. There are portions of this bill that do address the Office of Healthcare Strategy.
And through you, do a lot of these things in this bill have to do with, as you explained earlier, the hospital system? And is that the purview of Human Services through you?
Going to turn it over to Senator Lesser.
Yes, thank you, Madam Chair. Through you, this committee has cognizance over the Department of Social Services, and the bill references throughout the Connecticut Medical Assistance Program, or Medicaid, and other programs that are directly overseen by the federal SNAP program, the Special Supplemental Food Program for women, infants and children, and other programs that are overseen by DSS. Through you, Madam Chair.
Representative Case.
Thank you, Madam Chair. And I'd like to make a motion to move this to the Public Health Committee through you.
There's a motion on the table by Representative Case to send 1203 to the Public Health Committee, and it's seconded by Representative Dathan. We will stand at ease. We're going to have an immediate committee Democratic caucus. So sorry, audience and members of our committee who are Republicans, please feel free to go get your lunch. Madam Clerk, can you put a sign on the door? In the nicest way possible, please leave the room. To Democrats on the Zoom, I will send out a Zoom link. Stay tuned.
So now, like, you can still.
Yeah.
Don't ever.
Don't take.
Oh, sorry, hold on.
Good afternoon. I'd like to call the Human Services Committee back to order. When last we left off, we were on item number 9, 1203, an act concerning medical debt, and a motion had been made by Representative Case and seconded by Representative Dathan to JF the bill to the Public Health Committee. Representative Dathan.
Thank you very much, birthday girl chair. I am going to withdraw my motion, my second, excuse me, but I do believe that we should be following what is germane to this committee. And I'm hoping if this bill does go to the floor, that the floor will look at the bill and then determine if it is relevant in public health or where it should be. Thank you.
Thank you, Representative Dathan. Senator Seminara.
Since Representative Dathan withdrew her second, I will second.
All right, so now the motion is still on the table. Motion by Representative Case, seconded by Senator Seminara. Any discussion or questions regarding this motion? To JF to Public Health. All right, will the clerk please take the roll?
Item number 9 on the agenda, SB number 1203, an act concerning medical debt. Motion to amend motion to JF to the floor to JF to Public Health. Representative Gilchrist,
No.
Senator Lesser,
No.
Senator Seminara,
Yes.
Representative Case,
Yes.
Senator Gaston,
No.
Representative Dathan,
No.
Senator Marr,
No.
Representative Butler,
No.
Representative Cook, Representative Exum, Representative Fortier,
Representative Fortier votes no.
Representative Hughes,
Representative Hughes votes no.
Representative Johnson,
Representative Johnson votes no.
Representative Kit,
Representative Kit votes no.
Representative Leeper, Representative Santiago,
Santiago votes no.
Representative Buckby,
Yes.
Representative Ferraro,
Long awaited, yes.
Representative Mastro Francesco,
Yes.
Representative Pizzuto,
Yes.
Representative Paletta,
Madam Clerk, can you please announce the tally? Wait, we have one more. I don't know. Is it too late because I said that out loud? Because you didn't announce the tally yet, I suppose, if you want to vote on the amendment.
Representative Leeper. Motion to amend, motion to J up to the floor to J up to Public Health SB 1203. Thank you. The vote tally is 21 voting, yeas are 6, nays are 14, absent not voting 1.
The motion fails. Now we're back to the underlying bill, Senate Bill 1203, an act concerning medical debt, a JF to the floor. I've heard folks' concerns about the need for this to go in particular to the Public Health Committee. At this point in the legislative process, referring it to Public Health would get it there very close to their deadline. And so I am asking members to vote this to the floor, thinking that the screening committee would then refer it to Public Health. Representative Case.
Thank you, Madam Chair. So if I may ask a question to the proponent of the bill or to yourself, in Public Health 6740 seems to have almost identical language. Why are we having that in both committees through you?
Senator Lesser.
Yes, thank you, Madam Chair, and through you to the representative. I think the idea is that we're focused on payment aspect, and public health is overseeing the regulatory aspect of a very similar set of issues. Through you.
But to my question, we have the exact same bill with the same language in two committees. And it actually belongs in public health, which is where the bill is right now, 6740. What brings it to the Human Services when we are not the overseers of Office of Healthcare Strategy or the hospitals? That is a public health bill. Through you.
Senator Lesser.
While we oversee folks who are receive Medicaid funds through our nexus through the overseeing Department of Social Services and their role as a major payer, I would say that what specifically what brings it to us is we were asked to raise it by advocates who testified in support of the bill. Through you.
Representative Case.
Isn't it sort of protocol within this building not to duplicate bills throughout committees? Through you.
We did just do that with the Aging Committee as well, so I would respond that we do that actually quite often in this building. Representative Case.
Okay, not in the past. We haven't done it. Maybe this year we have, but we have not done that in the past. There are going to be a lot of duplicate stuff. I just say there's a live bill in public health that's the exact same language. There's a live bill here. This is actually public health. I can't support it today. We need to follow the process. We need to take the inner workings of our staff and let them do their job. And we've drafted this in two committees. I just think that we're pulling hairs. Thanks.
Representative Johnson.
Thank you, Madam Chair, and thank you. I'll be supporting this bill primarily because I think that what's happened here is this is very complicated, and we have a situation where we have a problem all throughout the state in terms of the providers and patient mix. And when you take a look at the patient mix in the different hospitals, you have Medicaid, you have Medicare, and you have the private insurance companies, and then you have private payers who usually can't afford to pay the bill. And so with the Medicare and Medicaid pays about 50% of the actual cost. Medicare pays about 80% of the cost. And then you go to the private insurance companies, they're at around 120% of the cost, which is why we run into these problems with negotiations every year when they try to reduce their costs on the per patient basis cost. So we have these costs problems. And one of the situations here that the Office of Healthcare Strategy is charged to do is to try and figure out how to equalize access to all types of healthcare all throughout the state. And so we have that situation. And one of the aspects of equalization of healthcare all throughout the state has to do with the patient mix and where the hospitals are not getting the kind of reimbursement rates that they would get, say, in a wealthier district. So these are things that in my own, like I probably just have told you before in the past, my district is very, very poor. We have one of the poorest districts with most people on Medicaid and Medicare, to the point where the federal government recognized my district as a Medicare hospital, so that the reimbursement rates would be a little bit higher. So that put my hospital back in the red. In the black. And so these are the kinds of things that Office of Healthcare Strategy is charged to do. And I do take Representative Case's good remarks about the fact that this is a public health issue, absolutely. But it also is a finance issue and how we take a look at that. And I think we have to be able to take our policy and align it with our finances and what we're doing as a group, and make sure that we do the right thing when we're taking a look at this. So I think that the aspect of what we would do here would be very, very, very narrow. And I take that very much to heart, because I think that that's the only aspect of this that we should be looking at. And so for those reasons, I'll be voting yes, but I'm voting yes so that we would take a very narrow look as the Department of Social Services and the Medicaid group, and let the Department of Public Health and the Office of Healthcare Strategy address some of these issues that go across all different types of areas. Because as you all know from being here, that Medicaid, it's complicated. So is Medicare, so is health insurance, so is the entire healthcare system that we have. And so I'll leave it at that. And thank you for allowing me to make a few remarks.
Thank you, Representative. Any further comments or questions? Senator Seminara.
Yes, thank you, Madam Chair. With all due respect, with the good representative over there, everything that you just discussed is really not in our purview. This is not a bill that belongs in this committee. So with all due respect, I disagree.
Thank you, Senator. Representative Dathan.
Thank you very much. Medical debt is a huge issue in our state. We hear it from our constituents. We hear the cost of pharmacy drugs. We hear the cost of healthcare is just getting astronomical and out of hand. And I do have concerns with, folks being able to land on their feet as a result of medical debt. And I agree that we need to be talking about it, but is it a Medicaid issue, which is the cognizance of this committee? And that's where I have some concerns. And so while I believe that medical debt is an issue, my no vote today is going to be reflective of, I don't believe it is a Medicaid issue. And I think there are other mechanisms in our committee where we provide emergency Medicaid coverage to folks who are qualify for Medicaid or don't qualify if they're undocumented. Or hospitals also have insurance policies to cover uncompensated care. And I don't believe that medical debt falls into the Medicaid arena. So I will be voting no today. Thank you very much, Madam Chair.
Thank you, Representative. Representative Cook.
Thank you, Madam Chairman. And I'm happy that I went after Representative Dathan, because I don't think that I could have said it any better myself. And as I had said earlier, before we recessed and now we're reconvening, I don't think that this is in the right place. I would like it to see going to the right place, but if we're not willing to do that, then I will have to vote no today. Thank you.
Thank you, Representative. Any further questions or comments? All right, seeing none, would the clerk please call the roll?
Item number 9 on the agenda, SB 1203, an act concerning medical debt, motion to JF to the floor. Representative Gilchrist,
Yes.
Senator Lesser,
Yes.
Senator Seminara,
No.
Representative Case,
No.
Senator Gaston,
Yes.
Representative Dathan,
No.
Senator Mar.
Yes.
Senator Mar, I need your camera on one more time, please.
Oh, hang on. Sorry.
Got it now.
Okay, Senator Mar votes yes.
Thank you. Representative Butler,
Representative Butler votes no.
Representative Cook, Representative Exum,
Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Representative Santiago votes no.
Representative Buckby,
No.
Representative Ferraro,
No.
Representative Mastro Francesco,
No.
Representative Pizzuto,
No.
Representative Paletta.
Rep. Paletta votes no.
Thank you, Madam Chair.
As was mentioned earlier, we'll be keeping the votes open. Next, moving to House Bill, number 10 on the agenda, House Bill 5001, an act concerning resources and support services for persons with an intellectual or developmental disability. This is a JFS to appropriate. Do I have a motion?
So move Representative Dathan.
Moved by Representative Dathan, seconded by Representative Case. I will turn it over to Representative Dathan.
Thank you very much, Madam Chair. And I am so excited about bringing this bill out today to the Human Services Committee. Just going to quickly go through the language in the JFS language. With Section 1, we are proposing a new Transition Academy of Independent Living program to get people in the IDD community to live as independently or quasi-independently as possible in a 3 to 6 month DDS administered residential program. Section 2 is a study that is conducted by OPM, DOL, ADS, OWS, and the Council on Developmental Disabilities, the CBIA, and the DECD to look at employment assistance programs for people with disabilities and to create incentives around that. Section 3 is also a study conducted by OPM, DOT, ADS, DDS, and the Council on Developmental Disabilities, which is looking at the other states' best transportation practice for disabled individuals, expanding access of these transportation initiatives to other parts of the state that are more difficultly accessible. Section 4 directs DDS directs DSS in consultation with DDS within available appropriations to reduce wait list for all Medicaid waiver programs administered by DDS. So this section will actually be really focusing in on looking at being able to expand and reduce the number of people on the wait list and expand the people getting services, particularly for the home and community-based services. Section 5 is a study conducted by OPM, SDE, DSS, DDS, ADS, and the Council on Developmental Disabilities and DPH to develop and recommend a new statutory definition for IDD and consider new qualifying criteria. Section 6 requires DSS and OPM with available appropriations to expand Medicaid waiver programs covering individuals with autism to remove at least 600 individuals from the current wait lists. And we will be doing a report DSS will be reporting to Appropriations and Human Services by January 1st, 2024, and the progress in implementing this. Section 7 changes the asset limit for Husky C eligibility to 3,600 for individuals and 2,400 for couples. One of the key things I wanted to highlight here is we do need to align both the asset and the income limits within the federal rules under SSD and SSDI so that people are not adversely affected. And Section 8 talks about the income limit under Husky C and changes it to $14.65 per month. And we might need to amend the Medicaid plan under this change. And this will authorize the DSS commissioner to do so. Section 9 establishes a Purple Heart system under DESP for missing IDD individuals, similar to the Amber and Silver Alert systems. Section 10 authorizes funds for DES to establish and implement a local voluntary registration system for IDD residents. Section 11 requires that the DDS and SDE commissioners to collect and report the number of individuals receiving services from DDS or SDE and the number of persons who are waiting for the DSS Medicaid waiver programs. This needs to happen starting annually on December 15th, 2023 to the Appropriations, Human Services, and Public Health Committees. Section 12 requires OWS in consultation with SDE, ADS, DDS, DSS, and DMS to establish a behavioral health and human service career pipeline in partnership with the state workforce investment boards and regional workforce development boards. Section 13 is DDS to review the current Bill of Rights for IDD individuals located in the general statute, Section 17A-238, to recommend updates to the section to reflect all rights and remedies currently available in statute. This report must be returned to the Human Service and Public Health Committee by December 1st, 2023. Section 14 requires DAS to develop an online portal for secure sharing of information between agencies on individuals with intellectual, developmental, and physical disabilities with autism. Section 15 requires the Office of the Healthcare Advocate to establish a new position and to help individuals looking for state services for adults who need assistance. Section 16 requires a Connecticut Sentencing Commission to study the experience of persons with intellectual or developmental disabilities or autism spectrum disorder who are in the criminal justice system. This will be submitted to the Human Services, Public Health, and Judiciary Committees by July 1st, 2024. Section 17, Office of Healthcare Strategy, to establish a new position and serve as a statewide coordinator of programs, services provided by state agencies for persons with intellectual, developmental, or physical disabilities or autism spectrum disorder. Section 18 requires DDS in consultation with SDE, DPH, and the Council on Developmental Disabilities to evaluate the level of need assessments tool by state agencies that serve persons with intellectual or developmental disabilities. Section 19 is the issuance of bond funds to be used by DES to establish financial assistance for private builders to comply with fire regulation requirements for any group home equipped with a 5,000 gallon water tank or more. And Section 20, one of my favorite parts, establishes Intellectual and Developmental Disability Awareness and Advocacy Day on May 23rd. That's my summary, Madam Chair.
Thank you, Representative. Any further questions or comments? And I want to thank both Representative Dathan and Representative Case for your tremendous work and the staff. And I know you've met with so many different people in the community. So thank you for your tremendous work on this piece of legislation. Any questions or comments? No? All right. You don't want to say anything? Seeing none, Madam Clerk, will you please call the roll?
Item number 10 on the agenda, HB 5001, an act concerning resources and support services for persons with an intellectual or developmental disability. The motion is a JFS to approps, LCO number 6196. Representative Gilchrist,
Yes.
Senator Lesser, Senator Seminara,
Yes.
Representative Case,
Yes.
Senator Gaston,
Yes.
Representative Dathan,
Representative Dathan joyfully votes yes.
Senator Mar, Representative Butler,
Rep. Butler votes yes.
Representative Cook, Representative Exum,
Representative Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
Why, yes.
Representative Ferraro,
Yes.
Representative Master Francesco,
Yes.
Representative Pizzuto,
Yes.
Representative Paletta,
Rep. Paletta votes yes.
Senator Mar, are you on the Zoom? Okay, thank you, Madam Chair.
Thank you, Madam Clerk. We will hold the votes open. Next, we will go to number 11 on the agenda, House Bill 6702, an act concerning a consumer's right to repair a powered wheelchair. This is a JFS to judiciary. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Representative Exum. So there has been a lot of conversation back and forth about this piece of legislation. It is our understanding and that the proponents of the bill will continue to work with folks, advocates, those in the industry, to make this as strong a bill as they can. But the proponents of the bill felt that the language that you see before you should move forward. And so that's why we are JFSing it to judiciary. And so what the substitute language does, quick summary, it requires complex rehabilitation wheelchair dealers to make service calls within 3 days of notice of repair that renders a chair inoperable or unsafe to use. It establishes new warranty and repair requirements for chairs sold or leased on or after October 1st. It requires Aging and Disability Services Commissioner to set up a working group of industry reps and consumers to propose regulations by March 2024. It requires manufacturers or wheelchair dealers to establish 24-hour call response system for consumers. It makes violations automatic, a violation of consumer protection law, and it strikes underlying right to repair bill, requiring manufacturers to share data to allow non-authorized dealers to repair the chair. We heard from many individuals at our public hearing on how very long it takes for a wheelchair to be repaired, and that this issue has been raised for years. And so they thought now was the time to finally take some action. And with that, I'll ask for any questions or comments. Senator Seminara.
Thank you again, Madam Chair, for indulging me. This, in my eyes, is a drastically different piece of legislation that was heard in the public hearing. And I too have been in contact with many of the stakeholders in this, and I'm not sure if I agree that everybody is on board with this new language. So I have some questions. I'd like to go through some of the new language and see if we can get some clarification. Because now the people who testified don't have the capability of testifying on this new language, and it is drastically different. So as you mentioned earlier, on line 100, it says that uses of such a wheelchair no later than 3 business days, that repair would happen within 3 business days. I think that this is unrealistic due to the workforce challenges and other constraints that are out of providers' control. So that's just a comment there. On line 131 and 132, I'm wondering if somebody can clarify. It says an authorized wheelchair dealer shall employ sufficient staff to comply with the provisions of this section. Who determines what is sufficient staff?
The wheelchair dealer themselves.
Okay. And once again, has anybody taken into account the labor shortage that is facing not only this industry, but healthcare industry wide? So that's something that we need to take into consideration yet again. On line 186 through 189, it says the manufacturer or authorized wheelchair dealer shall cover all collateral costs and shall provide directly to the consumer a temporary loaner wheelchair for the duration of the period, while the original wheelchair is assessed and repaired. How do you think that this would be feasible?
I think that people were assuming that it would be easier for the company itself to get a replacement than the individual who is left without a functioning wheelchair.
And believe me, I know all too well what it's like to have an individual left without a functioning wheelchair. But as we heard in public testimony, that these wheelchairs are highly configured to each individual, if you recall. They're made for each individual's body. So it's a little concerning to me when we're saying that the consumer must, that we must provide, or that the manufacturer must provide a temporary loaner, given the fact that this is such a specialized piece of equipment. How is that going to happen? Through you.
I don't think it would be specialized to the individual at that time. It would be like we heard in the public testimony, folks were getting replacement wheelchairs that weren't specific to them. And the hope would be that they'd be able to replace the parts quickly enough to get them back into the wheelchair that fits their needs.
Well, that would bring us down to 2001 and 2004 of this, where it talks about the manufacturers and authorized wheelchair dealers shall fill all repairs and replacement orders for wheelchairs pursuant to this section from their own inventory, or having a written subcontract for the purchase of parts and items necessary to fill the repair and replacement orders. Although the supply chain is getting better, there still is huge supply chain issues. There's 22,000 SKUs that are involved with parts. How are wheelchair providers to keep in stock and all of these parts and be capable of putting together wheelchairs for temporary use, or even keeping these supplies on hand in an effort to fix wheelchairs that are their own wheelchairs with 22,000 SKUs and this type of time frame?
So I believe the thinking behind this provision is that the problem has been known to manufacturers and wheelchair dealers for, like we heard in the public hearing and have heard from folks for a decade or so, and nothing has been done to address the problem. And so this is one path to moving in the direction of making sure that the manufacturers and the industry has the parts they need on hand to be able to fix these wheelchairs at a much faster pace.
Listen, I agree that we have to address these issues, but the feasibility of having these types of supplies available, it's going to be virtually impossible. I'll move on to section 2014 through 2019. The manufacturer authorized wheelchair dealers shall keep a written record of all repairs, attempts made, including but not limited to the date a repair was requested, the type of repair that was requested, the date the repair attempted began, the length of time of the repair attempt, collateral costs covered, the results of the repair attempt, and the total number of repair attempts made. To my knowledge, I have spoken to a number of authorized wheelchair dealers, and they're already doing this. They do this because they have to report to the FDA any type of repairs that are made in order to keep track of the repairs for recall purposes. So we're already doing that, or they're already doing that. Moving on to section 4, which is lines 297 through 300. Any manufacturer or authorized wheelchair dealer doing business in the state and at least one other state shall employ sufficient staff to provide assistance by telephone to consumers 24 hours a day, 7 days a week. I guess my question is, what would be the benefit of doing this?
So that those individuals who need wheelchair repairs are able to get through and register their request as soon as possible.
And would the idea being that a wheelchair manufacturer is going to send out somebody at 2 a.m. in the morning should somebody call?
No, this just says that they have to be able to provide some type of assistance by telephone to consumers 24 hours a day, 7 days a week.
Well, that's going to require higher reimbursement and it's going to require additional costs. So something to take into consideration. Again, the other lines that are concerning to me is lines 303 through 305. The Department of Social Services shall not require prior authorization for repairs of a complex rehabilitation technology wheelchair, the purchase of which is covered by such a payer. Has DSS weighed in on this?
I don't believe so.
Then should at least this aspect of the bill go to the insurance committee?
Yeah, no, this has to do with our committee, and I would offer that as this moves through the process, we will certainly have conversations with the Department of Social Services. And if in fact this needed to be changed, we'd be able to do that later in the process.
Okay. Moving on to lines 306 through 313. No later than October 1st of 2023, the Commissioner of Aging and Disability Services, in consultation with the Commissioner of Consumer Protection, shall appoint and convene a working group consisting of a qualified complex rehabilitation technology professionals, authorized wheelchair dealers, and complex rehabilitation technology wheelchair consumers to provide input on requirements for timeliness and quality of a repair of complex rehabilitation technology wheelchairs. So before this meeting, we had discussed that all the stakeholders involved were very ready and willing to meet now. So why should we put this off until October when we possibly could be meeting now and having resolutions long before the October date?
I think folks might be open to changing this to July 1, but considering the session ends in June, we usually don't. We could also make it effective immediately upon passage. So I'm sure folks would be open to changing that date, but we couldn't put it for right now just because we're still working our way through the process and won't vote on the bill until May or June.
Okay, well, we possibly could have made this into a working group, which is perhaps another way or direction in which this should go, so that we can address these concerns immediately rather than without the bill, which is something that was discussed and suggested, I believe, by the original person who put the bill forward. One last question I have is line 346. It says include seating and position aids except for a wheelchair as defined in section 1. So are we now changing the definition of the wheelchair? Why are we doing that?
I believe that this would counter the definition of wheelchair in section 1. And so it was just a clarifying in the definition of what assistive technology device means.
Okay. Well, the bottom line for me for this bill, we heard very moving testimony on this bill and from various individuals throughout the state about how this is a huge issue. And you yourself, Madam Chair, just said that it is an issue that's been going on for decades. And I can tell you it is an issue that's been going on for decades because I live it. And I know all about what it is to need and get effective, timely wheelchair repair. So I was very much in support of this bill and very much looking forward or hoping that we would not need to legislate this bill and that we could handle it in terms of a working group. I find that the new language of this bill doesn't cover the original intent, and it further complicates it, and it further makes it as though or causes legislation where it doesn't necessarily need to happen, and we possibly could have worked through all of these issues in a working group. So it's a little disheartening that all of this changed over the last several days. And for that reason, I am going to be a no on this vote.
Thank you, Senator Seminara. Representative Case.
Thank you, Madam Chair. And just to echo some of the comments, but this bill has been in our committee. We've been looking at it and talking about it for quite some time. And we came to some conclusion and some agreements with many different stakeholders, including the industry and some of the advocates, that instead of a bill, a working group, something that we could start on this afternoon, or maybe tonight by the time we get out of here, we could actually start talking and working with everybody. I too personally have lived this with a family member who had a wheelchair, who required and needed to have it on a daily basis and live this. And I find it very hard coming in here today with a bill that we had some sort of discussions on. And then at 5:30 last night, I got S language that's 12 pages long that makes this bill almost impossible in order to get stuff done. And now it has to go to judiciary in order to have it happen because of all the legal language that has been put in here. we can't necessarily expect a manufacturer to have a wheelchair that's suitable for somebody when theirs is down, when it's customarily fit for that one person. Yes, we'd like the industry and the person who has the wheelchair, we want them to work together. We want to figure out a solution. There has been a workforce, there has been parts that you can't get. We've talked with the industry on making sure their repair people have tires, have bearings, have all the basic necessities to fix small things. And the larger things, we would have to come to an agreement on a time frame and where that can be done and how that can be done. I guess what this does, in my eyes, is this delays something down into October that we could start doing tomorrow. We could start having these groups working tomorrow without this bill. We have an agreement, and I think we discussed it in working through the agreement, that if that didn't work out, we have next year to come back and legislate it and say, guys, you didn't do what you promised. We need to live up to this, and we need to move forward with a bill. And yes, we're going to legislate it. But this moves it months and months down the road to where these people in this bill that, I mean, realistically, they can't meet on the legal basis of this bill until it's passed out of the House or legitimately passed out of judiciary, which is where it's going to, where it's failed before. Because of all the legal stuff that has been put in here. And darn it, I get it. As Senator Seminara, she lived it. As I did in my life with a special needs person in my family, I lived it with a wheelchair. And those parts are pertinent. But if we don't let the two parties work together and we force legislation, we're going to make it so unfriendly for these manufacturing companies to want to work here in Connecticut, because we're going to make it impossible for them to, we're going to mandate them to have parts that they can't even get. My concern and my hope was that we could just get these people, even if it's 6 o'clock tonight on Representative Gilchrist's birthday, they come together and they talk. And they talk and they work it out. They come to some agreements, and maybe two of us on this committee are on that working group that's not legislated. And then if things aren't done, we have a legal basis to go forward and put legislation. With that, I can't support it with all this legal stuff. It has to go to judiciary. And I think from what I'm hearing, the industry is willing to go out and start working with these people tomorrow. And I think they'll do that anyways before this legislation even starts. Thank you.
Representative Buckby.
Thank you, Madam Chair. With all the committees that we all are a part of, this one tends to hit home for a lot more people. And I think the testimony that we got on this initial bill, a lot of people spoke from the heart, as we just heard from two of our colleagues here speak from the heart. It's a little tough to digest a bill that people have the opportunity to come. And we mentioned before, the good chairs both mentioned how important it was for people to speak in public hearing on those topics. When it changes so much within the bill, it's kind of unjust to the people who came out to testify, that took the time to testify, to see something drastically different in front of them. So I just want to take a step back and make sure that we're doing the best thing that we can for the people who need our help. I think the other part of that is there's a part of what we do that truly has to have the response of the community and the public when they take the time to come and speak to us, be it via Zoom or written testimony or here in person. And I think by taking that away really is what we're doing with this. We're taking that away from those individuals. So that part's a little frustrating, along with the comments that the good ranking members both said. It's difficult, The one question I had within there that the good senator mentioned earlier was on line 131. She mentioned the authorized dealer shall employ sufficient staff to comply with provisions of the section. And I just wanted clarity too, that the definition of sufficient, I think you mentioned it was, that's the dealer would offer that.
The dealer would determine what sufficient staff they need in order to do so.
So I'm curious with that being in legislation, that can vary, sure, from dealer to dealer. But isn't that something they would do now as part of running their business?
I would think so.
I would, that's why I'm curious why it's in writing, why this becomes part of the bill, if that's something that they, I mean, to me, it's something they would be doing already. So I'm not sure why that piece, I was just confused by that piece of the legislation being in there. As far as legislation goes, that's any business and running your business. You have sufficient staff according to your own needs. If it's something that's put forward that, you know, the state's going to regulate and put into law that you need sufficient staff, I think that needs to be identified as to what that truly should be, based on either a customer base or whatever it might be, if that's what it is. But I mean, that's just, thank you for providing that clarity. I'm just, again, I think we need to take a step back and look at what we're doing here as legislators and make sure that we're offering the people a chance to speak, and then moving forward on the legislation that we had them speak upon. So unfortunately with this, as much as the topic is incredibly important, it's not something I can support at this time. Thank you, Madam Chair.
Thank you, Representative. Representative Cook, followed by Representative Dathan.
Thank you, Madam Chairman. I want for legislative intent, are we speaking about LCO 6233?
Let me just pull it up. Yes, LCO 6233.
Okay, so then I have a couple of questions. I just wanted to make sure that we were all on the same page. So on page 2, line 32, subsection 6, early determination cost. Are you with me?
Can you give me 1 second?
Sure.
The internet in this building is weird today. All right, I've
All
got
right.
it. What lines? I'm good. Thank you.
32,
Got it. And
Okay.
yes, what's your-
so point of, just for clarification, so it says early termination cost. Can you expand on that a little bit? I see how it reads. I'm just trying to understand who's responsible for the cost of an early termination. And then I see that there's a penalty for prepayment under a finance agreement. I'm just trying to understand it.
Yep, so the expense or obligation is incurred by a wheelchair lessor. And as a result of both the termination of a written lease before the termination date set forth in the lease and the return of a wheelchair to a manufacturer, that is the early termination cost. And it also includes a penalty for prepayment under a finance arrangement.
So in this case, is the lessor the person that is renting the wheelchair? Who is the lessor?
Madam Chair,
Yes, Senator Lessing.
I may be the lesser, but I'm not sure about that.
Senator Lessing.
I just figured that he needed to own that one.
The lessor is the person who leases the wheelchair.
So I want to make sure that the person who is leasing the wheelchair, so i.e. myself or anyone else, is not going to be on the hook for any type of an early termination.
Correct. This is the company.
Okay. And then down one more, it says early termination savings. So means an expense or obligation avoided by a wheelchair lessor, not Matt lessor, as a result of both the termination of a written lease before the termination date set before. I want to make very clear that we are not giving money back to the company. Like, is this how I'm reading this?
I read it that way because it's saying avoid, they're avoiding it. They're not being given it.
And then I will skip down to line 70. Under reasonable attempt to repair.
Yep, go ahead.
So reasonable attempt to repair means any of the following after the consumer has reported the nonconformity and made the wheelchair available to the authorized wheelchair dealer for repair within the applicable term of the warranty period. Nonconformity had been repaired not less than 2 times by the manufacturer, wheelchair lessor, or any manufacturer authorized wheelchair dealer. And nonconformity continues, yada, yada, yada. My issue that we have is we have a limited amount of wheelchair dealers in our state. So I believe the good senator over there gave me the 2. So if we are restricting it to a reasonable attempt, but we only have 2 dealers, what is the flexibility on repair? Because we might not have the ability to be repairing within a reasonable time if we only have 2 wheelchair distributors or dealerships. And then on top of that, it gets into a little bit more layered to that is some of these parts are not able to be acquired in a 24 to 48 hour time period. So my concern is if we don't have the dealerships or the folks that have these wheelchairs and we don't have the parts, where's our flexibility? And I understand that there's a 21-day issue, I understand the intent of this, but I'm very concerned that I don't want to set folks up for failure. I don't want unreasonable opportunities. And so I'm trying to understand where we are with this. If anybody could give that answer.
So as I mentioned at the onset, this continues to be a work in progress. And so, and I heard, the good senator and representative mentioning that folks wanted to come to the table. In the past, though, this issue has been raised year and year and year after year, and it's been a decade or so of no change. And so I would hope that the conversation does continue with the manufacturers as this moves its way through the process, and conversations can take place about what would be reasonable with 2 manufacturers in the state.
So then to follow up on that, I know the good senator had asked about a working group. And I want to make sure I'm reading this correctly, and maybe I am not, and I don't know where I saw it. There was some mention, okay, so the working group in section 6. Am I in section 6 of the working group? Okay, section 6, subsection B. Working group shall contain an equal number of individuals representing qualified complex rehabilitation technology professionals, authorized wheelchair dealers, which we only have 2 in as far as like manufacturers. And that the department, so the commissioner of aging and so forth and so on. And I heard that you say that we would be willing to look at the date. So we are committed to having a working group. Do we have to legislate that working group? Or can we just say to them, go figure this out in 2 weeks and bring us back the information?
If we don't legislate, they don't have to bring back information.
Okay. But I think that if we've had people at the table up till now that we're working together, there's nothing prohibiting them from working together right now to get us some solid legislation that we can get behind, correct?
No, they could do all the groundwork, and then once the working group is up and running, they just have it all ready to go.
Okay. And the only other thing I want to say, I mean, I respect the work in progress issue. But I also want to caution that social service for 24 hours, we don't necessarily have that right now. And that's not built into the budget. I think that we need to be very cautious when we move forward on this about putting a 24-hour piece component into that. That would be an unrealistic conversation. If we don't already have a 24-hour service, we're now inventing something that is not there, which I believe would then send us to a pros. So thank you.
Thank you, Representative Dathan.
Thank you very much, Madam Chair. And I'm going to echo a little bit of what my good colleague said, Representative Cook. I do have a concern about a 24-hour hotline on this. I know we heard so many stories of folks that are really suffering as a result of not getting their wheelchairs fixed. And I really believe we need to address that issue. But I think when we just heard a couple weeks ago that 211 is not able to satisfy folks on a 24-hour basis. How are we going to be able to do this? I just have a lot of concern about that. I really do hope that we can get the ball rolling on this a lot faster than October. I know in my experience of my Food is Medicine work group, that we started meeting right after the short session over the summer starting in June, and continued those discussions up until the end. And if in order to get, really strong legislation, that was what we needed to do. I do also have a lot of concerns that we are going to cause increases, in cost of these things if the wheelchair manufacturers are going to have to keep an inventory of some parts that, some might be straightforward, but other might be very bespoke to a specific type of wheelchair. And all of that storage of inventory is expensive. And also, as technology updates, can be obsolete down the way. So I do have some concerns about some of the different parts of this bill that weren't in the original bill. But I do believe that this is an important conversation because so many people count on their wheelchairs that we need to move this forward, pun intended. And I'm going to vote yes to get this moving. So thank you very much, Madam Chair.
Thank you, Representative. Representative Exum.
Thank you so much, Madam Chair. And I also would like to echo, I know this is not a perfect piece of legislation, and it certainly has had some changes that are questionable, and I recognize it's a supplier issue. I also recognize the issues of individuals who rely on their wheelchairs, and they have come forward to us asking for help. So we have built a level of awareness by discussing this legislation and looking through the testimony. I think that the request was made from some of the advocates for the October date, which is where that came from. So it's a part of listening, but there's nothing to stop the work from starting. If that's something we want to do sooner than later. But I really support the conversation. I think it's very important to continue to shine a light on this issue, and I will be supporting it. Thank you so much.
Thank you, Representative. Senator Lesser.
Yes, thank you, Madam Chair. And echoing Representative Exum's points, I think the best way to start that conversation would be to JF this bill this afternoon. I think those conversations would begin very quickly. And I think that it often takes action by a legislative committee to get people into a room to discuss. And I do understand that it's going to be an implementation issue to figure out if the industry can meet the very ambitious customer service targets set forth in this bill. But I would just remind the committee, this is not a mom and pop industry. This is a multi-billion-dollar industry, and some of these players are very large companies. They are making an awful lot of money from Connecticut consumers, and that's okay. But they should be able to meet some performance targets that we set forth. And I think this bill is a good faith attempt to start that conversation. And I will be supporting the bill this afternoon.
Thank you, Senator. Any further questions or comments? If not, would the clerk please call the roll?
Item number 11 on the agenda, HB 6702, an act concerning a consumer's right to repair a powered wheelchair. Motion to JFS to Judiciary, LCO number 6233. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Senator Seminara.
It's a no for me.
Representative Case.
No.
Senator Gaston.
Yes.
Representative Dathan. Senator Marr.
Senator Marr, yes.
Representative Butler.
Representative Butler votes yes.
Representative Cook. Representative Exum. Representative Fortier.
Representative Fortier votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson.
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Leeper, Representative Santiago,
Santiago votes yes.
Representative Buckby,
Sadly, no.
Representative Ferraro,
Ferraro, no.
Representative Mastro Francesco,
No.
Representative Pizzuto,
No.
Representative Paletta.
Rep. Paletta votes no.
Thank you, Madam Chair.
Thank you, Madam Clerk. All right, next we will move to item 12 on the agenda. An act concerning mandated reporters. This is a JFS to the floor. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Representative Leeper. This bill came to us from the Department of Social Services, and their intention here was to update their statutes to cover more individuals. They took a look at the Department of Children and Families and who they consider mandated reporters. Under the Department of Social Services, they are responsible for reporting elderly abuse. And so they wanted to, in some ways, mirror what was being done with regards to mandated reporters with the Department of Children and Families. The S language you have in front of you just clarifies who within the housing authority would be considered a mandated reporter. Is there any conversation or questions? Yes, Representative Leeper.
Thank you, Madam Chair. I just throw this out for future consideration on this and it's also possible I've missed whether or not these folks are included, but the community health workers, are they detailed in this already? Especially since we just or we're hopefully going to formalize their role. In addition, we're piloting the Universal Home Visiting Program in Bridgeport, and I would think that those folks should also be mandated reporters. And I know this had a bit of an elder focus probably when thinking about those individuals and professionals who are working with our seniors, but I think it could be a good opportunity to be thinking about all of our different populations. So I just add and maybe even doulas and nurse midwives. So let's throw those out for consideration as we continue to discuss this. Thank you.
Great, thank you so much. And we'll take that information back to the department if they haven't already heard it. Representative Hughes.
Thank you, Madam Chair. I just wanted to build on that. This is some technical changes expanding who's mandated reporters. And we basically expect any professionals working, public facing professionals working with the elderly are mandated reporters and understand their statutory requirements. And there is a training about that. So, and that's under the purview of DSS. So I support this bill, and even if they're social work, the community health workers are not explicitly named yet, they will be.
Thank you, Representative Hughes. Any other questions or comments? Seeing none, will the clerk please call the roll?
Item number 12 on the agenda, HB 6775, an act concerning mandated reporters. This is a motion JFS to the floor, LCO number 6206. Representative Gilchrist.
Yes.
Senator Lesser.
Yes.
Senator Seminara.
Yes.
Representative Case.
Yes.
Senator Gaston.
Yes.
Representative Dathan. Senator Marr.
Yes.
Representative Butler.
Representative Butler votes yes.
Representative Cook. Representative Exum.
Representative Exum votes yes.
Representative Fortier.
Representative Fortier votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson. Representative Kit.
Representative Kit votes yes.
Representative Leeper.
Representative Leeper votes yes.
Representative Santiago.
Santiago votes yes.
Representative Buckby.
Yes.
Representative Ferraro.
No.
Representative Mastro Francesco.
I'm sorry, just lost my track. Are we on 6775 mandated reporters?
Yes,
Yes, Master Shen votes yes.
thank you.
He threw me
Repres-
off with a no vote.
Representative Pizzuto,
Yes.
Representative Paletta.
Rep. Paletta votes yes.
Thank you, Madam Chair.
Thank you, Madam Clerk. We will continue to hold the votes open. We are going to hold item number 13 and take that up on Thursday, so please stay tuned. Item number 14, House Bill 6855, an act concerning Medicaid. This is a JF to the floor. Do I have a motion? Is there a second? Moved by Representative Leeper, seconded by Representative Exum. This is a placeholder bill. Any questions or comments? Seeing none, would the clerk please take the roll?
Item number 14 on the agenda, HB 6855, an act concerning Medicaid, motion to JF to the floor. Representative Gilchrist.
Yes.
Senator Lesser. Senator Seminara.
No.
Representative Case.
As the third placeholder today? No.
Senator Gaston.
Yes.
Representative Dathan. Senator Marr.
Yes.
Senator Marr, can I just, I don't think your camera one more time. I'm sorry.
Yes.
Thank you. Representative Butler.
Representative Butler votes yes.
Representative Cook. Representative Exum. Representative Fortier.
Representative Fortier votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Johnson. Representative Kit.
Representative Kit votes yes.
Representative Leeper.
Leeper votes yes.
Representative Santiago.
Santiago votes yes.
Representative Buckby.
No.
Representative Ferraro.
No.
Representative Mastro Francesco.
No.
Representative Pizzuto.
No.
Representative Paletta.
Rep. Paletta votes no.
Thank you, Madam Chair.
Thank you, Madam Clerk. We will hold the votes open. Now we will go to number 15 on the agenda, House Bill 6885, an act concerning Medicaid payment rates. This is a JF to appropriate. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Representative Leeper. This bill is a major priority of this committee. Well before the public hearing, but then we heard it at the public hearing. Current rates for Medicaid are at 57.5% of 2007 rates. And this is both an access to healthcare issue, but also a workforce issue. And we're hearing that many in the field, medical providers just cannot afford to provide care. And so they might take one Medicaid patient a month or 5 Medicaid patients a year. And as a state, if we are putting out there that we are offering Medicaid, we should pay providers what they're worth in order to provide that care. Additionally, like I said, as an access issue, we're putting it out there that folks are being covered by Medicaid and then they can't access the healthcare that they need. In addition to changing or updating rates, what this bill also does is includes 5 additional services that would be covered by Medicaid in school-based health centers. It increases the Medicaid rates for emergency medical transportation services, and it also requires DSS to conduct a study. And so with that, any questions or comments? Representative Case.
Thank you, Madam Chair. And looking at through the S language, do we have anything in here that actually offsets payments that go to the FQHCs? Through you.
There's no S language, but no, this bill does not address the FQHCs. We had a separate bill that addressed community health centers.
Just all of a sudden getting emails from FQHCs wondering why they're not included in this, and I was just curious as to what the answer was, if you have that.
I will say, like with many of our bills, we do anticipate this to continue to have dialogue around. And so certainly that could be an ongoing conversation.
Thank you, Madam Chair.
Thank you, Madam Chair. I just wanted to thank the leadership of this committee for prioritizing this bill. And we're going to do a lot of important work in this committee this session, but if we only were going to do one thing, for me, it would be this. And I'm just really excited about the opportunity we have through this bill to expand access to those neediest in Connecticut and hopefully retain our providers who support that population and expand it. So with that, just thanks.
Thanks, Representative. Representative Dathan.
Thank you very much, Madam Chair. And I am also very excited about addressing the rates. We have here in Connecticut, we have one of the lowest Medicare reimbursement rates, and it is affecting folks getting access. And I think that was well raised. One quick question for you. The study that is proposed, is that the same scope of study that was proposed in the governor's budget?
No, it is not. And so we do anticipate, again, the conversation continuing between the governor's office and ourselves as this moves forward.
Yes, because I think it was pointed out that there are over 400 types of providers in the state. And one of my concerns is that if we do kind of a blanket sort of raising rates, that we won't get all the nuances. And the important things that we need to look at is making sure that the specialist, the EMS providers, the pediatricians and others do get their rates done. And we need to make sure that we're doing it in a thoughtful and sustainable way, because we want to make sure that whatever we do is able to be sustained in all sorts of budgetary times. So I look forward to the conversation continuing. The other question was sort of what Representative Case mentioned about the FQHCs. We passed a bill bill out of committee earlier this session, and unfortunately I left my notes upstairs with the FQHC bill. And I just wanted to know how this bill and that FQHC bill work together.
I too would need to look back at my notes, but as I continue to say, now I sound like a broken record. As it moves through the process, we'll make sure that they speak to one another and work themselves out together.
Yeah, work in concert is what I'm hoping that we will have, because we do want to make sure that our FQHCs, who support so many parts of our state, some of our school-based health centers and others, that they are reimbursed, because they are very, very busy people and provide such important services to our communities. So thank you very much for prioritizing this bill, and I look forward to voting yes and continuing the conversation.
Thank you, Representative. Representative Cook.
Thank you, Madam Chairman. I think I agree with Representative Leeper. This might be one of the most important things that we're talking about right now in this entire legislative session. And we hear the need to do more with less and spread out our coverages. And we've heard begging and pleading on the increase of rates. And if we do not increase rates, people are going to go without services. People are going to go without the care that they need. And then we're going to find ourselves paying in a totally different manner. And this, in fact, covers all of that. We are able to increase our rates in a variety of different arenas to ensure that people are receiving the services that they need. I know that we've had battles here about different types of coverages. This would cover all of those folks that we are trying to help, if we can just do a rate increase. And I hope it's just not a 1% rate increase, because that really doesn't matter. That would mean don't do any rate increase at all. But we have all of our social service groups, the ones that we know about and the ones that have really been able to live on their endowments for over 100 years that can't do that anymore because they're really running out. And they're doing God's work in the way that we might not ever see. When you see, we have a group in our town that sees 1,000 children a month for dental. 1,000 children a month for dental. And they're asking for a rate increase. And they've not asked for anything for over 100 years. These are the folks that are really making a difference. They're in our schools, they're in our communities. They're making sure that even our youngest are learning what it takes to take care of yourself. So as you get older, you understand what that means. So I encourage all of us to do, if we do anything, we do this one. And collectively, I think that we can make sure that that reimbursement rate increase is substantial enough that folks can actually see and feel the difference. So thank you.
Thank you, Representative. Representative Master Francesco.
Thank you, Madam Chair. When Department of Social Services was here during a public hearing, I asked her how many people we have today that are on Medicaid in Connecticut. And the answer was a little over 1 million people. I was just think about that for a minute. We have a population of about 3.5, 3.6 million people. Almost a third of them are on Medicaid. Our cost to that, I believe she said, was $4 billion. Now, I clearly understand this is an important bill, and I certainly sympathize with our providers that they need to be need to have a higher reimbursement. But I also am sympathetic to our taxpayers too that have to foot this bill. And the $4 billion I mentioned was just our part of it. That's not including the federal match that we get. So while I'm very sympathetic to our providers, I want to make sure that people that truly need our services are getting them. I'm also sympathetic to the taxpayers of where that money is coming from. I'm also concerned that something that this significant, we don't know what the percentages we're talking about. I know it has to go to appropriations, and we don't know, we have no idea of what the cost is. So we're just kind of voting yes to kind of let it go to appropriations and let them figure it out. I don't really like to work that way. I like to have some sort of an idea of what this is going to cost the taxpayers. And something this significant really should not be a work in progress. We've had months. We've started our session in January, and I keep hearing in this committee that it's a work in progress. We're still working on it. How much time do we need? We've been out of session for, I don't know, since November people got elected. They could start working on their agenda then. They don't need to wait until they're sworn into office. And we keep hearing this is working. So what'll happen, it'll go to appropriations, it'll go to the floor, there'll be an amendment on these things. People aren't going to have time to read it because things move very quickly around here. So that is my concern. I'm very sympathetic. I understand the providers, and certainly they are not, I agree, they're not getting reimbursed to what they should be getting, and certainly don't want any services to end for the people who truly, truly need it. But just understand that it's the taxpayers that pay for this. 1 million people are on Medicaid in this state, $4 billion. And I really want to see this committee in this state start moving in the direction of getting people to be more independent of themselves, providing good jobs, reducing regulations for businesses so they can provide jobs for people, to make people independent. So, Madam Chair, I am not going to support this bill today. Something to this magnitude, I really need to see the full picture and to see what the cost is. And I don't know, perhaps things may change when it comes to the floor. I don't know. But again, I need to keep the taxpayers in mind too. Thank you very much.
Thank you, Representative. Representative Johnson.
Thank you so much, Madam Chair. And
Do you mind? Senator Simmons, you don't? Okay.
oh,
Representative,
no, please, no, I didn't mean to jump ahead of you. No,
okay.
no.
Representative Johnson, then followed by Senator Seminara. Go. Representative Johnson, go right ahead.
Look at that. Oh, thank you so much, Madam Chair, and thank you so much, Senator Seminara. I appreciate it. I just wanted to say that one of the problems that we have in keeping staff and making sure everybody gets the treatment has a lot to do with how much we're paying people and all of these jobs and what the Medicaid rates are. So it's really important that we try to keep track of that these are things that go straight to our funding and providers being able to hire people and us being able to take care of the 1 million people. has Representative Master Francesco said, in the state of Connecticut, because we do have some of the lowest payment rates. And of course, when you look at the lowest payment rates, you look also at the fact that we do provide a lot of services that other states may not provide. And maybe their payment rates are a little bit higher, but we are going to try and do it all. And I think one of the ways to do that is to take careful look and make sure that we have good payment rates in the Medicaid program. So thank you so much, Madam Chair, and thank you, Senator Seminara.
Thank you, Representative. Senator Seminara.
Thank you, Madam Chair, and my pleasure to allow you to go ahead of me, Rep. Johnson, no problem. I too agree that looking at the Medicaid rates is absolutely imperative. I just want to verbalize one concern I have with this bill is I feel that we may be picking and choosing at this point. And I'm hoping that it is a work in progress, as everyone has discussed, and that we will keep in mind that the governor also has his eye on a more holistic approach on funding for Medicaid in his budget. So I'm just bringing that to people's awareness that I'm concerned that there may be some facets of people that are going to be left out as a result of this bill. And I don't know if anybody has any clarification for that.
Is the question who would be left out?
That's correct. That would be the question.
No, I don't have an answer. And at this point, as we're looking through it, like I said, we'll continue these conversations to figure out that we can cover the most people possible as we look to do the study.
Thank you, Madam Chair.
Any other questions or comments? Representative Exum.
Thank you so much, Madam Chair. And I just want to make a comment that I think it's well overdue that we look at these rates. It's very important. One of the things I think about is sometimes the great legislation that we passed. I know we looked at a lot of mental health services that we were able to offer, but without having the providers, we don't get the work done. And I have listened, not just in this committee, but in other committees, time after time, the voices have really appealed to me. I know it's a major issue. We know it's a major issue, and I'm happy that it's being addressed. And I look forward to supporting this legislation. Thank you so much.
Thank you. Yes, Representative Leeper.
Thank you, Madam Chair. I just want to make the comment that without these programs and providers, these folks end up in our hospitals, which we also as taxpayers pay for, and it is a premium, much more expensive than getting a federal match for providing preventative services at a lower cost, because that federal match also ensures we get every cent of our tax dollars returned back to us as Connecticut residents. And I think we probably are all quite familiar with the fact that we pay a whole lot more in taxes to the federal government than we get in return. And so any opportunity to optimize and maximize every dollar we can get back from our federal government, I think is a win for Connecticut residents, while also expanding better healthcare. So thank you.
Thank you, Representative. Representative Case.
Always coming up with the last minute thing here. Just a question. So in reading the statement of purpose, I am on the right one, 6885, is that correct? So Medicaid rates the same services and require a study of Medicaid rates in certain long-term acute care hospitals and methadone maintenance providers. Is that correct?
That is correct.
Is that what I heard you say the word before, study? Is that the part of the bill of that they're studying the rates? Because we've talked about methadone rates for years in this committee.
Yes.
Okay. And my concern is, so this has to go to appropriations, so I don't want to give any false hope. I know that appropriations is looking at Medicaid rates. We have billions of dollars that are coming out of this committee. Although we do need to work to make things better in the state of Connecticut. I just don't know how we get there, but I'll have a few minutes before I actually vote. So thank you.
Thank you, Representative. Any further questions or comments? Seeing none, would the clerk please call the roll?
Item number 15 on the agenda, the last one, HB 6885, an act concerning Medicaid payment rates. Motion to JF2 approves. Representative Gilchrist,
Yes.
Senator Lesser.
Yes.
Senator Seminara,
Yes.
Representative Case,
Yes.
Senator Gaston,
Senator Gaston, yes.
Representative Dathan, Senator Marr,
Senator Marr, yes.
Representative Butler,
Representative Butler votes yes.
Representative Cook, Representative Exum,
Representative Exum votes yes.
Representative Fortier,
Representative Fortier votes yes.
Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago, Representative Buckby,
Yes.
Representative Ferraro,
Yes.
Representative Mastro Francesco,
No.
Representative Pizzuto,
Yes.
Representative Paletta,
Rep. Paletta votes yes.
Representative Santiago,
Hold on. Yes.
thank you. Thank you, Madam Chair.
Thank you, Madam Clerk. We will hold the votes open until 6 p.m. Madam Clerk, will it just be by Zoom?
Oh, I'll be here.
Okay, so it'll
room
be by
2000.
Zoom or here in 2A. Again, the votes will be held open until 6 p.m. Our next meeting is this Thursday, March 23rd at 10:30. Thank you all for the birthday well wishes, and we will now be in recess.
Senator Marr, can you hear me?
Yes, hi.
Hi, sorry about that. I think you're missing one vote. It
Yes.
is
On the wheelchair,
5001.
HB, is that the one I missed? Okay,
6196.
okay. I thought I missed 6702, the wheelchair vote. Did I get that one?
No, I got you for that one.
Okay, good. All right, so House Bill 5001.
Yes.
Senator
Thank you
Mar
so much.
votes yes.
Thank you so much. Have a great evening.
All right, thank you. You too.